Order. Good afternoon. For the record, I am City Councilor at Large Julia Mejia, the Chair of the Committee on Education. It is Tuesday, March 21st, 2023, and we are here today for a remote hearing on docket 0244. The public may watch this hearing via live stream at www.boston.gov/city-council-TV on Xfinity 8, RCN 82, files 964. It would also be rebroadcasted at a later date. In accordance with Chapter 107 of the Acts of 2022, modifying certain requirements of the open meeting law and revealing public bodies of certain requirements, including the requirement that public bodies conduct its meetings in a public place that is open and physically accessible to the public, the City Council will be conducting this hearing virtually via Zoom, and it is also being recorded. This enables the City Council to carry out its responsibilities while ensuring public access to its deliberations through adequate alternative means. Written comments may be sent to the committee email at ccc.education@boston.gov and will be made part of the record and available to all counselors. We'll be taking public testimony at the end of this hearing, or I might switch it up and bring in public testimony beforehand. I reserve the right to do so. But just in case you have signed up for a public hearing, know that we will be calling on you. So please sign up for public testimony. If you haven't done so, please email Juan Lopez at juan.lopez@boston.gov with your full name for the Zoom link. Today's hearing is on docket 0244, order for a hearing on establishing a mental health curriculum in Boston Public Schools. This matter was sponsored by me, Councilor Julia Mejia, and was referred to the Committee on Education on January 25th, 2023. Today, I am joined by my colleagues, and I am not sure who was here first, but I will just say that I have Councilor President Flynn, Councilor Anderson, Councilor Coletta, Councilor luigien, and I believe that is all. And I'm going to ask someone from Central Staff or someone from who can help me out in making sure that we keep this order. And if you have arrived, I know Councilor President Flynn, you're always the first one here, so I want to make sure that if I didn't call your name first and you were the first one, I need you to let me know if I got the order right, because I'm sure you were here before everybody else. So, and I believe Councilor Murphy is also with us. So if you don't mind, Councilor Flynn, if you were first and I called you in the third line or whatever, just let me know, okay? Because I'm just catching up right now in terms of order of arrival. We are joined by community advocates, administration officials, and students who will be making presentations and providing testimony on the matter before the committee this afternoon. We have three panels testifying today. For the administration, we have Jill Carter, who's the Senior Executive Director in BPS Office of Health and Wellness. We have Shirley Tedesco, who is the Director of Education in the Office of Wellness, Health and Wellness. We have Jenna Parafusica, who is the Director of Student Supports, and Dr. Kevin Simon, who is the Chief Behavioral Health Officer for Boston Public Health Commission. And I know that you, both Dr. Simon and Jenna, have hard stops, so we will be calling you first, even though I didn't call you first, but just know that that is how we're going to lead with you all first. So that we can make sure that we have you and your time with us. Then for our community panel, we have Dr. Gail Crum-Swaby, who's the president of the New Generation and Associates, Dr. Charmaine Jackman, who's the founder of InfoPsych, Inc., Carla Hines, who is the coordinator of Mental Health Ambassadors Program at the Boston Project Ministries. And for our youth and student panel, we have Luigien Gonzalez, who's a BPS student at the Jeremiah Burke, Maya McNeil, who is a Boston resident and will be bringing in the perspective of what life is like for students who are MECO students and the type of services that they receive out in the suburbs. And then we also have Cheryl DePina, who's a private school student, Brimmer Day in School, and former BPS student. And the reason why we've invited students from different perspectives is I think we can learn a little bit about what life is like outside of BPS. So I would like, before I move on to my opening remarks, give my colleagues an opportunity to start off with their opening remarks. And thank you to my team for getting the order right. And I'm sorry to say, President Flynn, that Councilor Murphy beat you to it this time. So she was the first one here. So Councilor Murphy and the Vice Chair of the Education Committee, you now have the floor. Guys, I'm having internet problems, so if I am frozen.
Hello.
Okay, good. All right. Councilor Murphy, you now have the floor.
Thank you. Thank you to the sponsor of this. As everyone on this call knows, a mental health curriculum is imperative, I believe, to make sure that we're not just supporting students after the fact, but we're actually teaching them the skills they need at a young age. As a kindergarten, most of my years spent in BPS was in early education, so I know it's necessary, not just a middle school, high school health class, but we're really getting in at a young age, which is separate, right? A mental health curriculum in BPS is separate from the need also to make sure that our teachers are trained properly and have the supports they need, and the staff in the school that work directly with our students to also have the social emotional wellness training necessary, that our kids are surrounded by adults who can respond and react in appropriate ways, whatever they need emotionally. As we know, if kids are not ready to learn, their brains are going to shut down. Kids who are under stress are not going to perform well and learn how to read and write. And I do believe there's a direct correlation between our very low reading levels and the data academically connected to the social emotional wellness of our students. So happy to be on this call and strong supporter of this going forward. So thank you, Councilor Mejia, for having this hearing.
Thank you, Councilor Murphy. I am going to move on to Councilor Coletta, representing District 1. Councilor Coletta, you now have the floor.
Thank you, Madam Chair, and thank you to you for your leadership and the other makers in bringing this forward through the council. It has been widely reported that our kids are in crisis just following the COVID-19 pandemic. Everybody on this call has been doing incredible work. There has been significant investments in social and emotional wellness supports for kids outside of the classroom, and it only makes sense to ensure that those supports come inside the classroom. And we are educating our kids about mental health and why it's so important, and at the end of the day, trying to break the stigma. This was certainly not something that we talked about in high school, middle school, or even elementary school, and I do think that it's about time, just given the overall national movement, to ensure that we are centering ourselves and taking care of ourselves, both body and mind. I think it's time for something like this to happen in BPS, and I look forward to learning more about everybody's work and how we can be helpful as a council. Thank you, Madam Chair.
Thank you, Councilor Coletta. I am going to now move on to President Flynn. You now have the floor.
Thank you, Madam Chair, and thank you, Councilor Mejia, for your work and leadership on this critical issue. Thank you to the BPS team in this field for your important work as well. Just want to reiterate what my colleagues have said, that mental health counseling, emotional support services to our BPS students is critical, but also let us also acknowledge that we're going into the budget season now, and it's important for city councilors to support these types of programs and services as we discuss the budget. So again, just want to say thank you to Councilor Mejia, but also to the panel from the BPS, but also the panel from the community as well. Thank you, Councilor Mejia.
Thank you, President Flynn. I am going to now move on to Councilor Anderson, representing District 7. You now have the floor.
Thank you, Madam Chair. Appreciate being here. Really appreciate this filing. As you know already, this issue is very near and dear to my heart. And I worked in public health and provided home-based mental health services for about 11 years. So still trying to figure out how exactly we can implement services or actually embed these types of simple, interventions or skill building within our curriculum. Super important. Genius of you to file. Looking forward to the conversation. I won't belabor this talking point. Yes, I don't want to turn it into an hour of blah, blah, but really want to hear from the experts and folks from, of course, Health and Wellness, BPS, here, Dr. Simon. Looking forward to your input. And we, as we understand it, as we know it, we don't necessarily have legal purview in the BPS curriculum, but this is a wonderful opportunity to open up the topic, have a conversation, and hopefully come to a reasonable solution as to how we can address these issues. Thank you so much.
Yeah. Thank you, Councilor Anderson, and thank you to my colleagues for joining us today and to the administration panel, community activists, parents who are tuning in, and students. And I also wanted to, just before thank you, Councilor Luigien. You now have the floor. Thank you for putting that hand up. Sorry about that, Councilor Luigien.
All good. I won't belabor the point because I know some folks are on a time pressure. Just happy to be here, happy to be part of this conversation. I'll just say that one of the interest areas that I have in this is we need more guidance counselors. We need more social workers. We need more adults in our schools that are supporting and loving our students. And one way we do that is by creating a pipeline where students can see themselves as being part of that support system. And you do that in part by creating a mental health curriculum and exposing our young kids to mental health as an area of importance, as an area where they can see themselves building a career. And so I think about potentially having apprenticeship programs for our young kids and how that could be a spin-off or be part of work that we build out in a mental health curriculum. So important that we're having this conversation, as all of my colleagues have said, also important that we're talking about curriculum, but we're also talking about the supports that our students need to succeed in our schools where a lot of our kids are hurting. And there's also an incredible opportunity for us to think outside of the box here in terms of what it means to support the mental health of our young kids and the behavioral health supports, like what that looks like and how that can be untraditional systems and places. So excited for this conversation. And thank you to the admin for being here.
Thank you, Councilor Luigien. And before I start, just wanted to make sure if any of my other colleagues have joined. I'm just going to do a quick look on the Zoom. I don't see anyone, so I'm just going to dive into my opening comments, and I'll just be really quick. So we know, so before we even dive into the whole conversation, I want to be really clear that there's a difference between social and emotional learning and mental health, right? So I appreciate that that our schools have incorporated social and emotional learning tactics and techniques through all of their lessons. So I really want the administration to ground this conversation in understanding the difference between social and emotional learning and mental health and wellness. And that this conversation really is about an opportunity for us to create a curriculum that is standard across all schools, every grade level throughout the entire district, K through 12. So that's kind of just want to give the framework and the backdrop that we really want to make sure that all kids, no matter what grade level they're in, they have access to age-appropriate, relevant content that is about helping them understand the importance of their mental health and wellness. So I just kind of want to name that. I also want to name, as we continue through guiding this conversation, is because of COVID, we already knew that a lot of our families were experiencing trauma, but post-COVID, we have seen an uptick on the number of students who have, we've seen a high rise in suicide. We have seen, or attempts, we have seen young people with more rates of depression. I mean, we already know what's happening, right? And so our goal is, as we continue to talk about what we can and cannot do, is to really use this hearing to lean into and figure out how can we, as a district, ensure that every student K through 12 has a set standard of educational material. If you want to call it a curriculum, if you want to call it a session, but there has to be something that's standard, right? In a commitment. That's what I'm really looking for from the district, and to learn what that potentially can look like. And I'll just say that post-COVID, under Dr. Crump-Swaby's leadership, our office partnered up with Dr. Crump-Swaby and created the Mental Health and Wellness Ambassadors Program. And we had last year 12 young people from across different schools who participated in a mental health and wellness training, and then they became peer ambassadors in their schools. And this year we decided to take that same model and be laser focused on one school, which is the Jeremiah Burke. And in that school, we're going through an intense program, and our hope is it's twofold. It's not just helping young people learn about their trauma triggers, but also helping identify those triggers in their peers and connecting their peers to the support services that they need. In addition to that, the goal is, if we can create a pipeline, this is really a workforce development initiative. So young people are learning about mental health and wellness as a career and a viable career option for them. So it serves two purposes. One is to help support students in their mental health and wellness, while the peers who are going through this program are learning about this as a viable career that they can potentially pursue. So we hope that, as we continue to navigate these conversations, that we can create more opportunities like this, where young people are learning, but sharing, and then also developing that pipeline. And through being exposed to this as a career is the best way we're gonna do just that. So as we continue to have these conversations, I just kind of want to ground us in that frame, so that we can make some things happen. So with that, I am not going to belabor the points. I am going straight into the panel so that we can get to the business at hand. I understand that, Jenna, you're here just to answer some questions, so do not worry. I will not be putting you on the spot just yet. So I'm going to start off with Dr. Simon. You now have the floor.
Yeah, and can you hear me?
Yes.
Awesome, so thank you. So good afternoon, Councilor Mejia and the honorable members of the committee. So I'm Dr. Kevin Simon. I'm the inaugural Chief Behavioral Health Officer for the City of Boston, operating through the Boston Public Health Commission. Before that role, I am and continue to be a child and adolescent psychiatrist and addiction medicine specialist at Boston Children's Hospital. And clinically, I've provided care to many youth who have had some relationship to BPS or Boston Public School. And then actually before that, I'm the son of Haitian immigrants. My dad was a public school teacher in New York for over 25 years before becoming a social worker. And then I do actually have family here in Boston who are teachers, nurses, and administrators within BPS. So I speak from a multitude of vantage points. As noted, the COVID-19 pandemic era kind of did usher in new challenges for youth in Boston, but also nationally, which is leading to this current mental health crisis that we're in. So much so that the Surgeon General, American Academy of Pediatrics, and American Academy of Child and Adolescent Psychiatry declared this to be actually a crisis a little bit over a year ago. So the mental health issues and challenges for Boston youth have predated the pandemic. This is drastically visible in our hospitals, where the number of youths who are presenting to the emergency room with behavioral health concerns or mental health concerns is overwhelming the system. Now, there are many factors that go into behavioral health, mental health. They're kind of best thought of as the social determinants of mental health. So adverse early life experiences, low access to mental health resources and services, even food insecurity, housing instability, poverty, poor built environment, neighborhoods that individuals may be in, are just to name a few. So there's a need for more mental health care and services specifically for Boston youth. In response to that urgent need for better coordinated, evidence-informed, and effective behavioral health resources, BPHC actually did establish the Center for Behavioral Health and Wellness in June of 2022, or this last year. And the center aims to align, coordinate, and promote behavioral health and wellness programming across the city. In particular, we want to support historically marginalized communities, and as Boston builds and strengthens its own behavioral health resilience, the center envisions Boston where everyone can achieve their own version of optimal mental and behavioral health wellness through equitable, trauma-informed, and intersectional strategies. So we do thank Mayor Wu and City Council members for supporting our efforts to address the issues already mentioned and those brought up by council members. As noted, within there's something called the Boston Community Health Needs Assessment / Boston Community Health Implementation Plan. That's the CHINA-CHIP is the acronym. The center, and there's 3 CHINA-CHIPs, 2019, 2020, and then 2022. So the center is actively engaged in developing, writing, and promoting several requests for proposals that address aspects of behavioral health, because in each of those reports, behavioral health or mental health was highlighted as a top 3 need. So the first RFP that we issued from the center was the expansion of behavioral health workforce pathway. This aspires to expand, implement, and support new and existing efforts to recruit diverse behavioral health workforce. And I say workforce specifically, not to only indicate, licensed clinicians, but that could also be peer recovery coaches, that could be peer leadership, such as teens. And so having more available, accessible, diverse providers or workers, again, would strengthen that sustainable pathway. And so we're actively, that RFP period closed, we're actively reviewing several applications. The second RFP that we issued is the Behavioral Health Communication and Public Awareness Campaign. That RFP is an opportunity to help families and communities learn about behavioral health conditions, risk factors, symptoms, and treatment. Also, the goal is to increase awareness and use of Boston-based behavioral health resources, of which there are a number that have come online vis-a-vis the state as of January 2023. To reduce stigma surrounding the need and or use of behavioral health services, because unfortunately stigma still does exist, particularly in marginalized communities, and shape stories that normalize the support of lived experiences. So again, and the center aims to engage youth throughout this process of the communication campaign, given that that will be the prioritized voices. In addition to the aforementioned, we are in active discussions with BPS leadership and mental health colleagues to assess how best to address student and system needs, foster new collaborations, and ensure coordinated efforts in response to students, parents, teachers, and staff, their pressing mental health concerns. BPS itself has a mental health presence within BPHC itself has a mental health presence within BPS. Peter Raphalakis is our licensed clinical social worker who provides a clinical leadership to the BPHC school-based mental health teams. Those teams include licensed social workers and mental health clinicians. And currently, we have 7 clinicians who are providing direct individual therapeutic counseling within 8 BPS high schools. And so that's, again, a partnership that affords us an opportunity to be engaged and be supportive in the mental health aspect for BPS students. Over the years, we have learned that students have reported consistently the issues around trauma, grief from loss, and anxiety related to the immigration experience. And again, the pandemic has worsened that. So we are in agreement that supporting mental health demands more multifaceted and culturally nuanced approaches. So, in closing, I'd like to emphasize the importance of mental health support for Boston youth, Boston parents, teachers within BPS, and commend the committee here for exploring creative approaches and opportunity with regards to behavioral health. Thank you for your time. And if you want slides regarding the RFPs that were described, we can provide that.
Thank you, Dr. Simon. I really do appreciate your brevity and your use of time. And yes, if you don't mind, I'm more than happy to, whatever slides you want to share with our office, we will also amplify on our socials, because not everyone is tuning in right now, but we definitely would love to be able to disseminate whatever information you have for us. So thank you for that. I am going to move on now to Jill Carter, who is the Senior Executive Director at BPS Office of Health and Wellness, then followed by Cheryl Tedesco. So Jill, you now have the floor.
Thank you very much. Good afternoon, City Councilor Mejia and the other City Councilor members that are on this call. As you've heard, my name is Jill Carter. I'm the Senior Executive Director for the Office of Health and Wellness. Health and Wellness is in Teaching and Learning, which is a department in the academic division. And the Health and Wellness Office is made up of a number of teams, including health education, which is what we're here to talk about today. Our office also leads and coordinates the district's work on the whole child. As you've heard, Cheryl Tedesco, the Director of Health Education, is here with me, and she and I are going to share our opening remarks. So I'll get started and then pass it over to her a little bit. On behalf of the Office of Health and Wellness, we appreciate the time to speak in this hearing. We share the Council's commitment to nurturing, caring for, and setting students up for success in all aspects of health, including mental health. Our approach to this commitment is framed through the CDC's whole school, whole community, whole child model. The district aims to provide mental health services, a supportive school environment, and health education and instruction, engaging with BPS families in these efforts. Today, we're here to specifically address the instructional component, or mental health education. During our time, we'll share the district's policy and framework for health education inclusive of mental health education. We'll discuss how the district supports schools centrally, and then we'll share where we're at and some of the challenges we face in fully implementing our vision for comprehensive health education in BPS. First, let me say that health education strives to improve health outcomes for youth and their families by teaching the knowledge and the skills necessary for lifelong healthy choices. As clearly indicated in the order for this hearing, the mental health of our students is deeply concerning, and as we just heard, it's really at a crisis state. Results from Boston's most recent middle and high school youth risk behavior surveys conducted in the fall of 2021 further reinforce the importance of prioritizing students' social, emotional, and mental health. We shared with you the 10-year trends for 4 key social, emotional, and mental health data points from the 2021 Boston High School Youth Risk Behavior Survey. And from that, you can see that the proportion of high school students that felt sad or hopeless increased precipitously over the past few years, reaching nearly 45% in 2021. This feeling of persistent sadness also rose to 36% amongst middle school students. Self-harm behaviors among high school students significantly increased since 2019, and the percentage of students that felt close to someone at their school decreased significantly. For both middle and high school students, these experiences were consistently more common among female students and students identifying as lesbian, gay, bisexual, questioning, or another sexual orientation compared to their male and straight peers, respectively. Further, Black and Latinx students were significantly more likely than their white and Asian peers to attempt suicide. Mental health is a critical part of overall health and well-being. Education on the various dimensions of health, including mental health and the relationships of physical and mental health, enhances students' understandings, attitudes, and behaviors that promote health and well-being. I'm going to turn it over to Cheryl to give you a little bit of an overview of what our health education and mental health curriculum looks like.
Thank you, Jill. Good afternoon, honorable counselors, and thank you for this opportunity. As Jill referenced, today we are sharing information on BPS's mental health curriculum, which falls under the larger umbrella of our comprehensive health education K-12 curriculum. Let's briefly define curriculum. Curriculum is a standards and evidence-based sequence of planned experiences where students engage in rigorous and joyful learning to practice and achieve proficiency in content-specific knowledge and skills. What is health education in BPS, and what does it look like, and how does it incorporate mental health? BPS health education provides our scholars with a skills-based curriculum that is medically accurate, age and developmentally appropriate, data-informed, student-centered, and inclusive and affirming of all students. Mental health education is a key component of the health education curriculum. Health education builds skills and competencies, such as goal setting and decision-making, within a wide range of topic areas, including, but not limited to, bullying, cyberbullying and violence prevention, sexual health and healthy relationships, substance misuse and harm reduction, and of course, mental health. The CDC states, healthy students, successful futures. We aim to be certain that every child in every classroom, in every school, gets the health education instruction they need to be healthy and thrive. The vast array of health education topics and skills are rooted in national standards, social emotional learning, intersectional pedagogy, and anti-racism and trauma-informed practices. Students show significant social, emotional growth when taking part in health education classes because it's a class that's focused on them. As one of our BPS middle school students said, health education builds who we are. As an organization, we care deeply about the individual growth students experience from health education, as well as the community and public health impact comprehensive health education can offer. Aligning with our district goals and priorities, health education improves literacy, which is a person's ability to understand, to evaluate, to communicate, to act on and access health information services, not just for themselves, but for all those near and dear to their hearts. We see health education as a factor to increasing health equity in the Boston community. BPS health education instruction is informed by policy, and that policy states the following course requirements: delivery of BPS Healthy and Safe Body Unit in elementary grades, 2 semesters of health ed in grades 6 through 8 taught by a licensed health educator, and a 1-semester course of health education in total in grades 9 through 12 taught by a licensed health educator. The policy also provides recommendations for comprehensive health education across all grades, K to 12. Our current mental health curriculum, grounded in social emotional learning, empowers young people with the agency needed to build skills related to obtaining and maintaining positive mental health, understanding mental health diagnoses and support, destigmatizing mental health, and increasing access and knowledge of mental health services within the school and the greater community. The curriculum provides essential knowledge in mental health and promotes skill development for managing stress and anxiety and engaging in self-care. Lessons focus on self-esteem and awareness and health-enhancing behaviors like building a personalized mental health toolbox and learning how to access valid, reliable resources. At the middle and high school levels, there are 12 lessons per grade band. Informed by data, BPS enhanced our mental health curriculum in school year 21-22 in the midst of the pandemic. The mental health lessons are housed in the Digital Health Education Learning Library. Office records show that these lessons have been shared with 78 middle and high school teachers and staff. The Office of Health and Wellness provides professional development, instructional coaching, technical assistance, additional resources, materials, and family nights to present the information on our mental health curriculum. This school year, the mental health curriculum was shared in health education professional development forums, reaching 52 teachers across 38 schools. Mental health awareness, support, and services requires an orchestrated effort from the entire Boston community. Youth need to know that someone cares about them. They need to feel connected. Building strong bonds and relationships with adults at school, at home, and in the community provides youth with a sense of connectedness, which has been shown to improve mental health. In addition to our mental health education curriculum, K through 12, we collaborate with BPS colleagues in the Office of Social Work, Restorative Justice, Behavioral Health Services, and Succeed Boston to implement specific health education topics. We are united in our effort to align language and interventions across multiple tiered system of support. BPS efforts are also enhanced and supported by community health partners. We are proud to continue our work with the Boston Public Health Commission, who provides mental health programming, services, and initiatives in our school. We appreciate and work closely with the health resource centers, the school-based health centers, the Boston Youth Resiliency and Recovery Collaborative, the Youth Prevention Program, and the Division of Child and Adolescent Mental Health to meet the wellness needs of the whole child. In closing, CDC research shows that surrounding youth with the proper support can help to reverse the adverse mental health trends and help our youth now and well into the future. Healthy students, successful students. I will now turn it back to Jill, who will briefly share data. Jill?
Thanks, Cheryl. Now let me share briefly how we are doing.
Jill, I just wanted to just quickly interrupt. I let the timer go on a little bit longer. I just wanted to just get a sense of how much data you're going to give us, because
just probably 2 or 3 minutes of just giving you the current state of how we're doing and implementing what Cheryl just described, so you have a better sense of how how far across the district it's actually implemented. So, but is that, do you want me to wait? Or
fine. I guess what, and I'm not sure what the data you're going to share with us, but here's some data that I want to make sure that we,
Sure.
I'd like to know how many students across the district. I'd like to know how many schools, which schools, what neighborhoods they represent. And I'd like to know a general ballpark figure about like how many hours are we using for mental health and wellness, not social and emotional learning, because those two things are different. And I just want to keep re-emphasizing those two things, because emotional learning is a tactic and a way of like showing up and being emotionally intelligent, but mental health and wellness is very explicit. So I just want to make sure that as we continue to have these conversations that we're speaking the same dialogue.
I appreciate that, and your the nuanced understanding of the difference between social emotional learning and mental health curriculum. So I appreciate that. I'm going to tell you a little bit about where we are with schools. I may need to get back to you on some of the hours and some of the other pieces, but we can do that. So with that, I'll just share a little bit. In spring of 2022, School leaders, health education teachers, and PE teachers completed the CDC's school health profile surveys to assess our implementation of school policies, programs, and practices related to health. And what we learned there was that in 2022, 87% of schools said they tried to increase student knowledge on mental and emotional health in a required course in any grade of grades 6 to 12. However, only 54% of schools with grades 6 to 12 offered health instruction, either as a part of the required health education course or another required subject. Of middle school and high schools that required students to take at least one health ed course, a third had courses taught by licensed health education teachers. 40% of schools did not require students in grades 6 to 12 to take a health education course. In the same year, 2022, fewer than 50% of schools taught health education in at least one elementary grade. Finally, fewer than 30% of schools in BPS followed the minimum health education policy requirements that Cheryl explained shortly ago. The good news is that this year and in recent past years, schools and the Office of Health and Wellness have added and continue to add investments in part-time and full-time health ed teachers in an effort to improve the quality and equity of health ed instruction in the district. ESSER funding and other grants have allowed us to hire staff who will increase health education in schools over this year and next. 20 more schools are offering health education this year than were last. Moving forward, we will continue to build an understanding that comprehensive health education, inclusive of mental health, is a strong academic content area with specific student learning outcomes and a centrally provided scope and sequence. We will work to increase the numbers of licensed health education teachers in the district. We will continue to strengthen our collaboration across the student service departments and health education teachers to ensure common language, service linkages, sharing of resources, and support for instruction. And all this with the goal of fully implementing the BPS health education policy. However, in order to meet our vision and these goals, we do need to overcome some challenges related to this, and some of which I've already mentioned around staffing and other things that we can take up in a little bit. I just wanted to say that health education strives to improve the health outcomes for youth and their families by teaching the knowledge and the skills that are necessary for lifelong healthy choices. And we know that this is a critical part of addressing the mental health crisis. And it obviously needs to be well embedded with the other services and supports that everyone has already mentioned. So with that, I thank you for the opportunity to share, and I'll turn it back to you.
Thank you. Thank you for that. I'm going to go in the interest of time, making sure that we have an opportunity to have my colleagues ask questions. I also have questions too, but wanted to be super mindful of the hard stops that have been flagged for me. I'm going to start with questions, and we're going to start with Councilor Murphy, followed by Councilor Coletta, then followed by Councilor Flynn, Councilor Anderson, and then Councilor luigien. Councilor Murphy, you now have the floor. That is if you're still here. Going once, twice, 3 times. I'm going to keep it moving. Councilor Coletta, I know you were here, and I believe you still are with us. So, Councilor Coletta, you now have the floor, and I know you held a hearing last week in regards to creating a curriculum around climate and environmental justice. So it seems like we're all trying to help support BPS in the best way we know how, and would love to give you an opportunity to ask your questions. Councilor Coletta, you now have the floor.
Thank you so much, Chair. And you know what, I'm actually not in a position to ask questions that I would like, so I'm going to yield my time. Would you mind coming back to me after my colleague?
Absolutely, absolutely.
Thank you so much.
No worries. President Flynn, you now have the floor, and I am going to start the timer, 5 minutes.
Thank you, Madam Chair. Again, I want to say thank you to you and to the panel for the important work they're doing. I guess my question is, listening to the conversation for the last half hour, 40 minutes or so, with the almost 3-year pandemic and the learning loss for most students, I guess, what can the city council do to be helpful to BPS students, to you and your team, as we advocate for certain programs and services? Is there anything specific that we're able to do for you to make your job easier, but also to, more importantly, to support our students?
Well, I think, some of the challenges we face are really, we don't have the health education teachers that are really necessary to offer health education, comprehensive health education in the ways that Cheryl's described at all of our schools. So, definitely appreciate that in past years, we've increased a lot of our student support services in making sure we have nurses in every school, we have social workers, we have psychologists and school counselors, and we really appreciate that. And I think that, ensuring that we're actually making sure that there's tier 1 health education for all students is critical, and that really requires staffing at schools for health education. So I would say that's one element that I wanted to highlight as a challenge. The other challenge is that we face is schools don't necessarily, they're trying to fit a lot into a school day, and so it's having staff, but it's also having time in the school day to make sure that we can offer a health education curriculum. And so, that's probably true, and maybe what you hear for other curriculum topic areas that folks come and talk to you about as well, because we always want to offer a lot of a really well-rounded course of studies, but sometimes that's challenging. And then I would just say the last thing when it comes to health education that might be a little bit different is to recognize that in Massachusetts, the Massachusetts Mass Core requirements for graduation don't require health education. So many states require health education as a part of a graduation requirement. BPS has its requirements, but I think when you're thinking about sort of the different policy levels, I think having Mass Core include a requirement of health education would be something that we should work towards. So I'll stop there.
Thank you, Jill. Maybe as a follow-up, so these teachers that are engaged, that are teaching this program, health education, we need more teachers, certainly. The current teachers we have, when they are teaching, what I was always concerned with is not to make sure that their work schedule is completely full, give them an opportunity to relax, to take a break, to take a break, basically, because things are challenging for these teachers as well. But do we have also the paraprofessionals that help these teachers with the subjects and can help the students? But it's also important for the social and emotional health of the teachers as well, because it's very difficult to be teaching courses during this time when you also have your own challenges at home with your own children, and sometimes you do need a little bit of a break to relax instead of just going 7-8 hours straight. Just want to see what your thoughts might be on that.
Yeah, thank you for that question. I can't speak specifically to paraprofessional supports in health education classrooms. That is something that is of very importance to the district, I know, as we are focused on, inclusion as an approach to education overall. But in terms of your point about really the well-being of our teachers, staff health and well-being is really critical. And as a district, people are aware of that, and we are working towards that. We actually, through our ESSER funding, were able to add a staff wellness manager position. And we've been writing grants for years, where we can help schools get additional resources that really support those kinds of well-being, those activities, and even thinking structurally about how can we improve the health and wellness of our students and staff. So that is something that WEDA is a part of the Office of Health and Wellness. Our wellness policy also has a staff wellness policy component. So we definitely see that as being critical. Even within, if we're going to have more health education teachers, or any teachers for that matter, we need to make sure that they feel supported and cared for. And I was thinking earlier when you were all talking about a pipeline for career, we need more health education teachers too. And so I'm hoping that all the efforts that we're talking about around career pathways can include health ed teachers as well.
Thank you, Jill. Councilor Mejia, do I have time for one more question?
You are the president of the council. I am going to give you another 45 seconds. How about that?
Thank you, and I'll be brief. So Jill, can you just explain, and I know, I don't really know the definition of health education, and maybe some of our listeners don't necessarily know the definition of health education. Can you just explain it for us, please?
I'm going to let Cheryl answer that one because she's very good at that. So, Cheryl?
Cheryl, I think you're on mute.
And there we go.
Yes, thank you. Thank you so much for that question. I really appreciate it. Health education is a Tier 1 curriculum that helps students practice and adopt the skills that they need to make healthy choices. We have been working to enhance the understanding of health education. Health education is grounded in 6 behaviors that the CDC has found to be the leading causes of morbidity and mortality among students. So and I can share those 6 categories if you'd like. So health education teachers provide essential skills like communication, relationship skills, advocacy for self and others, analyzing the influences that young people are exposed to every day and every grade level. And then they provide that core content like disease prevention, violence and injury prevention, nutrition, online safety and bullying prevention. And most important, and I taught health education for 20 years. I came out of the classroom to come to Boston. Health education teachers are that trusted adult, that consistent adult in the building that creates safe and supportive learning environments. And they provide that culturally and linguistically affirming student-centered approach that supports student achievement and well-being and empowers young people to be agents of their own health. Students love, I just have to add, students absolutely love health education because it's the course that is all about them, and it answers the questions that are top of mind as they journey on their path of growth and development from kindergarten through grade 12.
Well, thank you, Cheryl. I didn't know all that, so I'm glad you brought that up. You informed me, you educated me, and maybe you helped some people listening too. So I want to say thank you for your response as well. Thank you, Madam Chair.
Thank you, President Flynn. I am going to move on to my colleague, Councilor Anderson, representing District 7, followed by at-large Councilor luigien. So, Councilor Anderson, you now have 5 minutes and the floor.
Thank you, Madam Chair. 5 minutes and 45 seconds, because although I'm not the president, I am the queen.
That's right. You got it.
No, just kidding. So I guess I really want to ask questions about implementation and specifically how this is tied into practices as we know of interventions or any type of like crisis management or problem solving skills. That takes time to build up, and also we have to create action plans or different types of monitoring system for behavior modification or monitoring skill building, and how we're making progress and how the adolescent specifically is making progress in terms of learning these skills. I want to understand your services, or how would you say that it does that specifically? Does it monitor how students in Boston Public Schools are learning these skills? And also, how are we actually keeping track of their benchmarks?
I'll start on that and then see if anybody else on my team wants to add to that. But health education, like any other course, like science or math or social studies, should include assessments. Those assessments are usually on obviously their knowledge or how they're able to practice, indicating, like, for example, if they're learning about healthy eating, how do we know if they actually could, work to or can demonstrate that they understand choosing some healthy choices or something like that, right? But so we definitely, like any other course, would be assessing their understanding and their ability to practice some of those things, especially around healthy relationships and some of those others. But I heard you in your question maybe ask, is what's happening in the Tier 1 curriculum connected to what might happen or need to happen if there's need for a Tier 2, meaning a small group support or an individual support from something that might be coming up and would need that additional support from our student support team? Is that am I right in understanding that question?
So close. The point of implementing social-emotional health, a curriculum to teach children social-emotional skills, we have to be able to measure benchmarks. We have to be able to say, by a certain age, or even if not by a certain age, because we know that each child differs in terms of their, time and development, but that by a certain time specifically, we want to see some sort of growth. We want to understand that you have covered these set of skills in education. And I think that the services that you provide are reactionary, although very necessary, but I think that they are more interventive, or that they are after the fact, right? It's more of the Western approach, that we are, treatable. Things are treatable, not curable. And I think preventative means curriculums, that we, before the fact, that we're teaching children these types of skills to address, again, crisis management. And it means that they would have learned these skills very early on. Not only that, I've heard conversations about facilities and how outdoor, experiential learning or facilities can complement such curriculums. So obviously, Boston investing more in state-of-the-art facilities to be able to give children such experiences, maybe sports, right? We know that research shows different ways. But monitoring this progress means a curriculum. It means that we're creating action plans to say, certain children, because you do that in home therapy, you also do that in outpatient, right? Where you actually monitor children's, objectives or reaching objectives, but we don't do that with social and emotional anything in the schools. We're services that are addressing children with needs. And so I think it's a totally separate thing. Again, it's after the fact, but not preventative. So I'm asking, if you were to build out, if there are such services, or if you are addressing certain students with social services, are there other ways that we are measuring benchmarks that we're reaching with kids learning these skills?
Right. I'm going to let Cheryl take, I do just want to say that that's why we agree with you, and that's why everyone needs to be taking health education that starts in kindergarten and goes up. And the lessons themselves, like you said, are age appropriate, and they're actually stepping students through the development of a spiral series of skills. And I hear you asking, so are we monitoring that? And I'm going to turn that to Cheryl, because I can see you wanted to add.
Yes, thank you so much for the question. I just want to emphasize that our mental health curriculum is based on national health education standards that have benchmarks for different grade levels: pre-K to 2, grades 3 to 5, grades 6 to 8, grades 9 to 12. We focus in on the lessons that we have appeal to the multiple intelligences of young people. They use universal design for learning, and we have a very detailed and scaffolded scope and sequence. So that means the lessons in the younger grades build upon the knowledge of the grades prior, to make sure students have practiced and acquired that skill. We have a rigorous curriculum that includes higher level thinking. And so while our curriculum is preventative in nature, we ask students to evaluate the validity of the health information that they're receiving, for example. That's one of the benchmarks and one of the things that we would be assessing. How valid is the information that they're receiving on Instagram, on TikTok? And so they're processing collaboratively with their peers as they explore that benchmark. We can talk about the interpersonal communication benchmarks. And so they would have to demonstrate the refusal skills. How do they use their refusal skills if they are asked to vape? How do they use their refusal skills if they find themselves in an unhealthy relationship? How do they adopt strategies to help them prevent, manage, resolve those interpersonal conflicts without harming themselves and others? And always, always, who is the trusted adult for that young person? How are they connected at school, at home, and in the greater community?
It doesn't tell me exactly. Thank you so much, Cheryl.
Oh, I have one other thing to add. I'm sorry.
Wait, because no, because I'm still stuck on one question.
I have the answer.
Okay, Cheryl.
Yeah. So you asked. I think you're asking how we measure, right? And so we measure in health education and assessments. I would pass it on to our social workers to talk about how they measure. I think what's really important is to understand the triad relationship. So for example, say we're talking about mental health, and a student reveals in health class that they're cutting. I know that problem is bigger than me, and I don't have the skills. So then I would immediately help that student get the help that they need from the social worker. We'd probably also incorporate the nurse. So there is incredible power in the connectiveness of a nurse, a social worker, and a health teacher, understanding that they all bring different skills and talents to the table, and together they're wrapping their arms around the student and making sure that they're healthy and well.
Cheryl, I appreciate your age appropriate. I feel like I'm 10 now. I really like it. I feel cozy in this conversation. I really appreciate how warm you are about your answers. Still looking for the response, and specifically, and I like that you gave me examples of on interventions and specifically skill building, but I wanted to get to the part where we talk about, look, obviously, the idea here is implementation in curriculum, and how a health class, if it lives in a health class, how do we do that? And then how do we have the conversation about figuring out and implementing behavior modification or implementing benchmarks so that we do know that we're impactful. So I am still looking for that response, because if it doesn't exist, again, the curriculum it's where we try to figure out how we implement it. Thank you so much.
Thank you, Councilor Anderson. Here's the challenge that I'm going to present to my colleagues who are here. There's going to be Councilor Luigien is going to ask some questions, and I'm going to ask some questions, and I'm going to ask you all to marinate on the question that Councilor Anderson has proposed, and I may use some of my time to dig in a little bit deeper to hopefully get to that. So hopefully you won't need that digging, and you'll be able to be like, aha, because I really want to make sure that my colleagues, get the type of answers that they're looking for. So I'm going to, in the interest of time, move on to Councilor Luigien for questions. And if Councilor Anderson is the queen, Councilor Luigien, I need to know who you are so I know how much time I need to give you.
I'm the city councilor.
She's the princess. I'm the queen. She's the princess. It's
okay, princess.
Step down. It's okay.
Thank you. I promise not to take up too much time. My first question is regarding, and thank you all for being here. A lot of when you want to create new curricula, it really often starts off via pilot programs or creating an elective. So what would that process look like of creating an elective, maybe in some of our high schools where we are able to have a health class that incorporates behavioral health and introducing our kids to it like a field of study in the same way that they can take an environmental science AP class or a statistics class? What would that look like programmatically, and is that something that we can make happen?
So I'll take it. Right now, students should have a health education class in high school. And right now, what's required is only one semester of health education in high schools. Doing a comprehensive approach to health education in one semester, as you can imagine, is difficult. So that requirement's already there, and some schools do have health education teachers that then would incorporate the mental health curriculum that we're speaking about in that course. Is that what you're asking about, Councilor? Or are you saying, could we add another elective that would be? Is that another elective? Oh,
right. So I am a BPS student, right?
Yeah.
BPS student. No, I wish. I'm a BPS graduate, and I was able to, starting in the 10th grade, really choose what my schedule looked like. After I met my requirements. I don't recall having taken a health class, but if you tell me I did, then I did. But just as an offering in the way that we are able to offer, right? We all take a version of a science course in my school. You could take environmental science, you could take, chemistry, you could take physics, right? And so in the same way that you're able to do these offerings as electives, having a mental health class be an elective, that's a pilot elective in some of our schools that our students can take advantage of.
Yep. Yes, our department has sort of the governance, if you will, over different courses that schools, we could work with a school who wanted to do that, help them design an elective, and then work to get that elective offered, as a course in a school. So what they would need would be the curriculum part wouldn't be the problem. It's more their school being able to have time on the schedule so that students could actually opt in for that elective, and then also obviously a teacher that would have enough time in their schedule to teach that. But that's not that schools could definitely work with our office to do that. So.
Great, and I'm wondering if that's just the way that that's the way that we should go here, as like a pilot, finding and identifying a school. Cheryl, is that a quasi hand?
Well, I appreciate the question, and I would be excited for our young people to have those health education electives. My concern is that our scholars are not receiving the standards-based, skills-based health education curriculum class and to meet the policy. So first I would like students to have, let's call it a health education 101 in grade 9, and then they would have the opportunity to perhaps take contemporary issues for teens in health education. So I think they at first I'd like to see them have that health education class. And we do have some schools, as Jill mentioned, that have a health education teacher. And I'd like to go back to the challenges, which is finding time in the schedules to provide that the time for health education.
Mm-hmm. Yeah, and I understand the time and the schedule things, which is sort of why I proposed a potential way of doing it is that you make it, I'm not talking about a requirement, at least right now, I'm talking about it as an elective.
I worry about equity, right? So I want every single student to have this very important curriculum so that they feel like agents of their own health. And we do have the policy right now. So I know that we can work together to be certain that all our young people from East Boston to Brighton to Allston, West Roxbury, Rosedale have health education.
Yeah, thank you. I appreciate that. And I understand where you're coming from. I just, in terms of implementation, how usually get your foot in the door to be able to offer something and to scale it is usually the pilot program. So that's sort of why I was offering that. I have a question for Dr. Simon regarding the 2 RFPs that you said have been put out. What are you doing with those RFPs to ensure that we're getting, or that we're able to reach potential folks and organizations that traditionally aren't in our pipeline and we're doing business for the city of Boston, which tend to be organizations run by folks of color and by women and by people who just traditionally don't have access to our systems?
Yeah, so thanks for the question. So when I started in the role, because again, the RFPs, the first one came out in February, the team met with over 80 organizations. And so in terms of ensuring that the bids or the RFPs were known, sent it out on a listserv, highlighted the website that all of the RFPs exist on for boston.gov. In terms of the first RFP, which is that behavioral health expansion pathway, there were more than 10 applications. And then within the application itself, which is any person can download, there's an emphasis on organizations or institutions that have a demonstrated history of working with certain populations. And then with regards to the type of learners or students that we'd be looking for, intentionality in terms of diverse backgrounds, historically marginalized, demonstrated interests within the behavioral health field. So again, the team is actively looking or evaluating the applications. I would suspect by the criteria that the team will develop, it'd be somewhat difficult to have it implemented and not to reach the target populations that we're trying to address. For instance, within the workforce one, the funds could be utilized to aid learners or students with social determinants of health issues, which is to say that could be used, again, the institution that applies has to be creative in how they're using it, but could be utilized for food access, could be utilized for childcare, could be utilized for transportation, because we know that those tend to be the challenges that present for learners, not necessarily just the academic component. So we were pretty intentional within the description of the characteristics of the type of learners we want, as well as the institution that's engaging in it. And then being pretty nuanced in terms of how funds could be utilized to maximally benefit those who historically aren't benefited.
Thank you.
Thank you. Councilor Mejia, is that my time?
Girl, your time was 2 minutes ago. I gave you
Okay.
extra time. But you,
Dr. Brennan, I just want to uplift the article that you wrote, the letter, the Imagine Boston area as a therapeutic landscape for young people, and how you think creatively about what it means to create therapeutic landscapes for our young people. And I hope the organizations that are participating in this RFP can think as creatively for what it means to deliver behavioral health services to our young people. So I wanted to talk to you a bit more about that, but I'll just put that out there, and I hope that we're able to get folks who are able to look at issues of the creative landscape that you're trying to look at it through. So thank you.
Thank you, Councilor Luigien. And I did. I want you to know that the clock did go off a few times, but I just kept going just in the interest of making sure that you felt fully expressed. But I want to be mindful that we do have another panel coming on and some folks that have hard stops. And I wanted to make sure that if there are a second round of questions that we get to them before we let go of the administration. So given the fact that I'm just going to start first, I'm just going to start off by just in gratitude, really thanking you all for bringing your full selves into the space. Really do appreciate you taking the time. I know that you were summoned here through the hearing order, but you could have sent someone else, but you decided to show up yourselves. So I appreciate all of that. Just want you to know. And then the other piece that I really want to kind of just ground ourselves in is that I want to be super mindful. At least I'll speak for myself, right? Is that, first and foremost, before I am a city councilor, I am a parent. And before I'm a parent, I am a BPS graduate and someone who experienced, mental health and wellness challenges while I was growing up, right? So for me, this is really near and dear. And I think it's really important for us to, at least for me, to try to create the type of space that we can speak in ways that parents can understand. So I just want to level set real quick before we go on with the way we are interacting here. I just think it's important for us to pause. The reason why we're holding this hearing around mental health and wellness is because we are all experiencing this crisis, whether it's the parents or the students, even the staff. We're all in this together, right? So I just want to level set that. And as adults, we have a responsibility to show up in spaces in ways that are vulnerable and that create space for people to bring their full selves into even hearings, okay? Because what I would like is for the parents who are sitting at home or who are going to watch this later, is for them to be able to understand the conversation that we're having here. So I'm just going to quickly break it down. We're having a conversation around the mental health and wellness issues that our students are facing and the possibilities of how we're able to implement some sort of practice, a curriculum, or some sort of commitment from the district that is going to ensure that every school and every classroom and every grade level has X amount of hours of instruction that is specific to the mental health and wellness of students. And I would like, for the record, please, in the most layman's terms, for someone to explain to our audience the difference between social and emotional learning and mental health and wellness. I'm going to ask Jenna because I haven't heard from you. I want to hear how you talk. So hopefully I hear something different. Let's go.
Well, thanks. I appreciate it. I will answer your question, but I wanted to just say, today I had the privilege to hear from Dr. Bettina Love in person. And one of the things she said was, a curriculum is a reflection of our values. And I first want to just thank the council for showing up and for you doing the hearing, because it means that your values align with thinking that mental health is important. So for me, I'm the director of student support. I support the social workers, restorative justice, and home and hospital. For me, mental health is really thinking about, yes, the holistic child, but also making sure that we are really naming and understanding that children have anxiety, depression, understanding what is happening post-COVID, whereas social emotional learning is giving skills, and they can be melded together. But I think what we're talking about is making sure that students know it's okay to talk about mental health, that students know that we are trying to destigmatize mental health. When I started 16 years ago as a school-based health in a school-based health center, nobody wanted to see a counselor. And then, you know, when I left Charlestown High 10 years later, it was everybody wanted a counselor. And so I think it's really figuring out how we manage to talk in a way to students, families, letting them know that mental health affects everybody. Everybody needs to manage their mental health. And so I agree. I think we need to figure out how to put that together. I can also say, you know, our social workers are honestly quite reactionary because of where we're at because of the pandemic. So while we work really hard to do tier 1 support, and we do have some programs like specific curriculums for suicide. One of the things you mentioned, Councilor Mejia, was the uptick in, you know, attempts of suicide or, you know, suicide ideation. We are thinking about making sure that we work with Children's Hospital. We have a Break Free from Depression curriculum. We have Signs of Suicide, which also makes sure that we utilize students to support their peers in accessing support. So I hope that answers your question. Happy to talk more if you want.
Yes, thank you. Thank you for that. Thank you. I appreciate it. And Dr. Simon, can you, from your perspective, kind of like help us understand how you see the difference between social and emotional learning and mental health?
Yeah. So it's a good question, and trying to set the level. Part of the challenge is the language that we do use in the realm of mental health, behavioral health, social emotional learning. So classically, social emotional learning is utilized to support students' mental health, which is to say, yes, you do learn skills, you do learn or have tools that when I think of mental health, now again, Councilor Anderson highlighted this, right? So I'm a physician, and so there's a frame that I have in terms of thinking about mental health. Mental health for me is, you know, someone waking up, how are they feeling emotionally, right? Are they feeling sad, happy, irritable, frustrated? It could also be, are you anxious because you have an exam coming up? Now, I'll just speak to anxiety for a second. Anxiety is on the spectrum, right? Some people probably today felt a little bit anxious before the 3 o'clock hour, which is completely normal because you're going to perform or you're going to talk in front of people that you don't usually do, right? That's the aspect of normal anxiety. It could swing where someone feels so overwhelmed with their anxiety that they're sweating, they're palpitating, they're short of breath, and they can't even present themselves in a normal way to the audience here. That does happen to our students in schools. So when I think about mental health, I think about actually the normal experiences that we have. Again, depression. So I'm from New York. If the Red Sox lose, I'm not particularly sad. If the Yankees lose, I am sad. But if I'm sad for a day, that's within the realm of normal. If I'm sad for 3 weeks because the Yankees lost, there's a question that has to be asked about, okay, is this sadness a little bit beyond the realm of normal? So mental health is the experiences that we all have, the challenges that within BPS, students within BPS, but then students just nationally, they've been experiencing the extreme ends of mental health, such as increasing rates of feeling persistently sad, feeling suicidal, and unfortunately, even fleeting suicidality is technically normal. People think about, what if I'm not here? Thinking about that is very different than forming a plan to do that, taking steps to enact that. So in terms of defining social emotional learning versus mental health, I think social emotional learning is the tools to help one stay within the realm of normal mental health And then mental health itself, yes, is the wide spectrum. And unfortunately, we can, for a variety of reasons, be on the extreme end of that spectrum where it does not feel good, even in my presence and in my being. So to not belabor the point, as well as I recognize that colleagues have time limits.
Yes.
I'll
And my
stop
time
there.
is about, that's right, Dr. Simon. I was about to come in and be like, hello, Dr. Simon. I got like 2 more minutes left and they're going to put my timer on. And even though I'm the chair, I don't want to go over my time. I want to model behavior. So no, I really do appreciate you helping to break that down. I do have some very specific questions for the BPS administration. And I really, in the interest of time, I'm going to encourage you all to just kind of like yay or nay it, or 3 or 5 or whatever the case is, because I don't want explanations, because I'm not going to have the time to really go through all of them, right? So I would love to just, I'm just curious, how many sessions are focused on depression and suicide specifically? How many? Do we know?
Cheryl, do you want to comment on that?
Sure. So there are 12 lessons specifically on mental health per grade. And so I would imagine that I would say 4 or 5 would talk about suicidality, but really it's about building a student's toolbox. So we are building their toolbox throughout those 12 lessons.
And those 12 lessons, are there across every single classroom and every single school and every single grade?
Ideally, if health education was implemented and funded as the policy states.
Oh, perfect. Is the mental health, the classes that you all teach, culturally responsive? And how are you defining that? Like, I want to know, like, how do you know it's culturally responsive? Did some Black or brown coalition tell you it is culturally responsive, or is this like, how do you all know it's culturally responsive?
So we always explore the social determinants of health in designing our lessons. We vet our lessons using the racial equity toolkit. I'm going to struggle with words now at the end of the day.
You do have some sort of framework in how you guide your culturally responsiveness.
Yes. We do. The district has a tool.
Perfect. In that you use it for this. Okay, perfect. What does the data, well, actually, I'm curious about where these classes are taught, in the gym or in the classroom or in the hallway. Like, where does this happen?
Yeah, so I always taught health education in the classroom. It is a core academic subject. It involves purposeful movement, so we do need a space to incorporate that movement and for students to work in groups. It is not taught in a gymnasium because that is not conducive to the learning that we do.
And I have a quick question. Do your lessons include racial trauma?
Yes, so we we use trauma-informed best practices, and that could mean racial trauma. For example, if students are immigrants, whether that was recent or in the past.
Yeah, or white supremacy, or issues of being followed when you go to a store and
absolutely.
Those things are real and traumatizing, and they spill into the way we show up in schools, because everywhere we go, we're like targeted. So I just want to make sure that there's a level of that happening in your space.
And we also use intersectionality too. So people show up with multiple identities as well.
Is the curriculum embedded in each of the classrooms? Like, is there accountability to whether it's being used in the classroom?
I think, well, some of the data that I shared earlier, Counselor, shows that, based on report outs from principals and health ed teachers, not all schools are currently implementing the curriculum that Cheryl has defined.
All right. So in the interest of making sure that everybody, I still have questions, but I'm going to ask Dr. Simon if, I've been working closely with clinicians of color in all aspects of mental health and wellness, and how actually, even before I became a counselor, I did a lot of work in the trauma-informed space, and really creating space for parents in particular to understand their own triggers, because we can do all of this work with our students, but then they go home to situations and they're not ready to receive them. So a lot of the work that I did in my organization was focusing on the whole family, the whole child, the whole family, everybody, right? So I'm just curious, you know, and BPS too, I think that we're missing out on a lot of opportunities to really partner with skilled clinicians of color who can help supplement some of your teachings, right? Who can help, like you talked about a staffing shortage. I think that this time requires us to be, you know, thinking outside the box, like Dr. Simon, really sending out RFPs, creating opportunities for people to be more engaged in this conversation. You know, I say that Boston is resource rich, but coordination poor. We should have everybody at this table right now having the same conversation and figuring out how we're going to create spaces for young people to be fully expressed. So to that, I'm just curious in terms of BPS and their partnership, you know, Jill or, you know, or Cheryl or Dr. Simon, what efforts are being made to really create opportunities for clinicians of color who have had a lot of experience outside of the BPS system working with our families? How are you bridging that gap?
So I'll speak broadly because I don't work for BPS specifically, but I am aware, and perhaps Jenna Paraffin could also highlight this, that within BPS there is a school-based collaborative, which I believe it's like 20 to 25 plus community organizations that provide behavioral health services within the school, and from a city and a state level. For instance, the state had its own set of RFPs with regards to recruitment for certain behavioral health clinicians, and some of the recipients were organizations that do exist within BPS, but I can't speak to a specific of BPS doing something targeted for minority clinicians, but again, I am aware of the 25 plus agencies, and a vast majority of the agencies actually have a high percentage of minority clinicians.
Yeah, no, I am encouraged by that there is at least a space for that type of connection building and skill building and participation. And I'm just kind of keeping on within that line of questions. Are we collecting any data on referrals from counseling and mental health crisis that come from health education classes? Is there a database? Or, I mean, I'm sure with HIPAA laws and all that, I'm not talking about names and contact information of students, but is there a way that you all are measuring the state? And that will be the last question, because I want to be mindful of my own time.
I will just say that, one of the things that we're teaching students is how to access resources, including within the school, whether that's social workers, nurses, other, folks. But in terms of measuring referrals from within a health education class to within the inside the district or out, we're not currently, but Jenna might have something she could add to that in terms of measuring of referrals.
Yeah, I don't have that explicitly, but I can tell you when we do break free from depression or signs of suicide, we have the person who delivers the curriculum, and then we always have social workers, school psychologists that are there for support. And then we have an exit ticket where they self-identify. And I will say that is fairly high. The exit ticket only asks, do you want to check in with somebody? Do you need to check in today? And that has been done, not across the board, but at some schools. And so we utilize and have supports and check in with every student that identifies on that.
Thank you. And I want to be respectful of my colleagues, and I kept them on a timer. And
Councilor Mejia, can I just add one aspect with regards to data? Thank you. So from the BPAC side, with regards to you're mentioning referrals, one thing that we do, or at least EMS, which is within BPAC, there is data that's available, not at the student name level, but number of calls that EMS will have with regards to emotionally disturbed persons, or EDP2s or EDP3s, in relationship to schools. So I just wanted to provide you with that additional information.
Well, thank you. I appreciate that. And in the interest of keeping the conversation going, I am going to ask the administration, if your schedule permits. I know some of you all have a hard stop, but there might be some questions that do come up that I think might be helpful to have you here. If you can stay, please do, but I'd like to be super mindful and respectful of our community panel that has been waiting. And so I'm going to ask Dr. Gail Crump-Swaby, Dr. Charmaine Jackman, and Carla Hines to please join us. And I'm going to start off. And I also know that John Reardon is here with Children's Hospital and will also be participating as part of the community panel, I understand. Is that true? Or making it up? It's true, okay. Welcome. In the interest of making sure that everyone gets an opportunity, your 5 minutes, I would love for you to introduce yourself, name the organization that you are affiliated with, and the voice and lens that you bring to the table. And unfortunately, because we do have young people who are also waiting to speak, y'all, I'm gonna each give y'all 5 minutes, okay? So I am going to start off with my colleague and co-conspirator on all things that matter, Dr. Crump-Swaby. You now have the floor.
Thank you, Councilor Mejia, and for the rest of the city councilors for having me here and making me be a part of this discussion. I probably won't take up my 5 minutes because I want to be mindful of other folks' time, and a lot of what has been said already that I was going to say has already been said. So I'll start off. Again, my name is Dr. Gail Crump-Swaby. I am first a mother of a 17-year-old who attends a Boston public school. She attends a Boston public high school, and I will choose not to mention the school because she tells me I'm always advocating for something. So to protect her privacy, and as she always says, she didn't give me consent, I will withhold naming her school. But I'll share a little tidbit of a conversation I had with her and then tell you a little bit more about me. About a month ago or so, she texted me while at school. And although I've told her many times that she should not be texting me while at school, she still did it anyway. But I think she knew that this text message would catch my attention. And this is how the brief text message went with her. Her first question was, Mom, did you receive an email about students meeting with the counselors at school? I said no. And her response was, they probably sent it to students, but you get to set up a meeting with one of the 4 counselors and talk with them for 15 minutes. She said, since I couldn't meet with the person yesterday, I met with another counselor today and felt like the system still won't meet the needs of all the students. She says, our health check-in is today. And my response again was, oh, that's great. I'm happy to see that the school is doing this. Again, she said, it's only 15 minutes. Each student gets 15 minutes. And it's not enough. Plus, they don't have enough counselors at this school. And my response was, well, at least they're trying. Did you get your 15 minutes? She said, yes, but that's not why I'm texting you. So tell me why. Well, 15 minutes is not enough, Mom, especially for kids who may need more than 15 minutes. No teenager will open up to someone they don't know in 15 minutes. A regular counseling session takes 45 minutes to an hour, and it takes more than an hour to feel safe to tell anyone what you might be going through, so the process is flawed. So what do you recommend? I said to her. And then I jokingly said to her, what do you recommend, Dr. Swaby? To her, who doesn't have a degree, is what I said. And her response was, they need to teach us about mental health and what to do if we don't feel right. She said, you know that thingy you do at those other kids' school. Well, did you share that with the counselor you checked in with? I asked. She said, no. I said, well, how come? Because I only had 15 minutes. And then I said to her, then she said, I wish there were more counselors. I said, well, do you have any suggestions as to what they can do? She says, well, I'll have to think about it. I said, well, maybe you can apply for the wellness director at your school. Now pay attention in class and stop texting. And that was the end of the conversation. So I say that to say, as a mother, a mental health therapist, advocate, the owner of New Generation Consultants and Associates of Mental Health Counseling, Coaching, and Practice, and also a professor at Springfield College, and the director of the Clinical Mental Health Counseling Program. I am here today to speak and to advocate for many of the young people that I have also trained within the community who are also Boston Public School students on a mental health curriculum that I have actually developed and used with these young people. What Dr. Simon was talking about when Councilor Mejia asked him, what's the difference between SEL and mental health? The way in which he described and explained about what mental health is what I teach those young people in the program that I have in the community. Because it's so important that these young people are aware of what anxiety is, how it shows up in their body, how they think about these different things, also depression. And I'm not going to go into the thoughts about the pandemic because that has already been said. We know that. Young people are now more aware that there's something wrong with their mental health, but they don't yet understand exactly what it is or how to get the support. We're at a point where people are discovering their mental health but believing their challenges are unique to them. And this can lead to increases in the symptoms of depression and anxiety because too many youth believe they are alone in their experiences. The current crisis is one of loneliness where many young people are stuck in the realm between knowing something is wrong and not knowing what to do about it. In order to improve mental health services for communities of color and for our young people, we must start by educating, empowering, and mobilizing our youth. We believe that young people are, we always say that young people are the youth for tomorrow, but they are the youth for today. They are a coalition, a movement of young people who are aware of what's happening for them. And we have an opportunity to make a difference by including in their schools mental health curriculum. We have trained young people in things like depression, how to recognize it, anxiety, suicide awareness, substance use, substance disorders. We actually go through teaching them about that, in addition to now what skills you might need in order to take care of yourself when those things happen. Give them access to resources. And then we take it a little bit further. We have those young people train other young people on the same curriculum. Because when you have peer-to-peer kinds of training, they listen more to their peers than they listen to us as the adults. We have a few barriers when I think about in terms of the system. I know teachers are stretched, even the social workers, the behavioral health folks in the school are stretched. We have issues of structural racism, implicit biases that gets in the way of our ability to really provide the kinds of treatment that young people need. Sometimes the misdiagnosis. So if we teach them about what diagnosis is, what those things about what depression is, what anxiety is, they can be advocates for their own mental health and wellness. And of course, we have the lack of treatment providers who don't look like them, who may not be coming from a cultural perspective. So I think it's so important for us to start with a shared understanding of what mental health is and letting young people know that, letting them know the differences between that. And I think Dr. Simon was very clear in terms of helping us to understand that everyone experiences some form of anxiety. So young people need to know the difference between anxiety when it's time to take a test, when it's time to do the MCAS, and anxiety that is not related or connected to that, but it's more of a generalized thing that is happening for them on a regular basis. So let's do what we need to do as the adults to increase and to include more of a mental health curriculum that provides education, awareness, so that young people can connect their mind, their body, and their spirit, while at the same time learning the skills needed to impact to take care of their own mental health and wellness, and then be able to extend that to the collective of their peers. And I think that will give us an opportunity to really bring together a system that is not just working for, the young people, but in some ways also working for the adults in the building. So I'm going to stop right there, and I don't want to take up any more time.
Wow. Thank you. I was about to call you Counselor Crump-Swaby, but I was about to congratulate you.
Not going there. Thank you.
We're all doing our part here. So, I love this panel. Dr. Crump-Swaby and I and Dr. Jackman and I worked in 2016. We created an event called Trauma in the Village, and it was, we did it in partnership with Kozbach, and it was really an opportunity for us to bring communities together around trauma informed. And it was like, what in the world is that all about, right? And so, I feel like we're having a full circle moment here, because we were on the other side. Well, you all were still doctors. I was on the other side. And now I'm here as a parent. And I learned so much about my own trauma triggers and how I was passing down really bad behavior to my own daughter, because I never really learned how to show up in a way that was trauma informed. And so this is why these conversations are so important, and really grounding it in the perspective of the people who are on the front lines doing the work in front of our kids every single day. And so thank you, Dr. Crump-Swaby, for sharing your interaction with your daughter. I can already see her face as she was writing it all. And Dr. Jackman, thank you so much for your years of service working in our Boston Public Schools. And I wanted to give you the floor. You now have the floor. Thank you.
Hi, good afternoon. And thank you again for always inviting me to be part of these sessions. I love to talk about mental health and share my perspective and experience. So I'm Dr. Charmaine Jackman, a licensed psychologist in Massachusetts, the founder of InnoPsych, which is a company aimed at disrupting racial inequities in mental health. I also work for the Boston Public Schools for 10 years, serving as Dean of Health and Wellness at Boston Arts Academy. And prior to that, worked at Children's Hospital with the Children's Neighborhood Partnership Program under Carolyn Watts and Shella Dennery for 7 years, and that where I was placed at Boston Arts Academy. So that's 17 years at Boston Arts Academy career. And so thank you for this time. So let me get into it, because I have lots to say. And I think this is it's somewhat revolutionary to think about a curriculum that's specifically focused on mental health for our children and adolescents. I think it is time that we do think and center the mental health and well-being of our children in our schools. And I just kind of imagine like what power, and think about what a process for stigma reduction that a curriculum like that would offer. So I'll share a little bit about what we did at BAA as a model for and advocated for this mental health curriculum, some of the challenges, and just some recommendations about what this could look like. So at BAA, we did the Break Free from Depression that I think Jenna mentioned earlier. We definitely felt that was a culturally responsive program because it featured young people from the city. We actually had a student from BAA that was on that video. There was another student from another school, I forgot what school it was at, but it was a Black male sports person who talked about his experience with suicide. So I felt that the stories represented experiences from youth in the city. In addition to the Break Free from Depression, we also felt it was really important to add a module on anxiety and mindfulness. So we included those components, and it was framed within our health curriculum, which was we included Break Free from Depression, which focused on depression and suicide prevention. We added a component on anxiety and mindfulness, and we also have a comprehensive sexual health curriculum. I think as Jill and Cheryl spoke, unfortunately, it was a program that we only offered either our 9th or 10th grade students. There was a challenge in finding time. I think that's always a challenge, finding time to really deliver that in a way. We wanted students to have it at least in, say, 9th grade and then again in 11th grade, because their needs change and evolve over time, what they took in. I think some of the benefits of this curriculum that I saw very, 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 very directly, I would have students come to our office and say, hey, my friend just said this to me. I don't want them to know it was me, but can you please help my friend? Or I just saw someone post on social media thoughts about hurting themselves or saying goodbye. Can you help? Can you intervene? But don't let them know it came from me. And so I think the power of a mental health curriculum was that students gained the skills and the knowledge to recognize early signs of suicide ideation, depression, whatever those things were, those challenges that their friends were sharing. And then they knew how to act, right? Because the focus of those programs were about action and what to do. We're arming students with tools on what they can do when they recognize those signs for themselves or for a peer. And we saw that very clearly in students acting and making decisions for the safety of their friends and their peers. This curriculum, again, as I mentioned at the top, huge impact in stigma reduction in terms of seeing youth come to request services, talk about just, seeing a counselor, bombarding the health and wellness office. But, I think that was also a challenge but a real prize, because students would come and seek support. And at the end of the day, that's what we want people to do. What we see in communities of color who have historically not engaged in mental health resources because of fear of hospitalization, they often wait till way too long till their problem is more severe to intervene. And then, of course, it becomes this cycle where they do need more intensive and more invasive resources. So the benefit of having a mental health curriculum is that we can provide young people with signs and symptoms that we could intervene when things are mild, right, before things really become a problem. In addition to some of the work that we did the mental health curriculum, we really felt it was important to assess all of our incoming students. So we had a wellness survey that we gave all of our students. And again, part of that was, again, helping students to connect to us, but also, again, help to identify and help students get to talk about the challenges that they were facing. So I think really think about this as being a comprehensive tool that gives really students the language to identify early signs, right? We really want to focus on that early signs. When someone has a mild mental health condition, it's really hard to tell, right? Unless they notify us, if they tell us, right, they can wear a mask. So having those early signs are really key. I just also want to emphasize, I saw that, I guess my time is running up, but I also see that having the curriculum taught by a mental health professional is really key. And I know we talked about having health educators. I think there's a difference. One, that we're intimate with the mental health curriculum, we know it. And also when students come to get support, there is a natural transition for that. So I would definitely argue for that. And I think one of the other things we talked about was how we develop the workforce. And so as someone who knows that I represent about 3% of all psychologists, all Black psychologists in the United States, and my identity as a woman of color, I represent about 13% of mental professionals in the United States. And so what a great opportunity for students to get exposed to these conversations and this topic, and also learn about career opportunities in the mental health field. So again, I would say this is revolutionary. Thank you, Councilor Mejia, for bringing this forward, because the time is now. You know, this was an issue prior to COVID, and it's even more so. And I think what a great honor and opportunity to arm our young people with tools that can help save their lives.
Thank you, Dr. Jackman. And I also want to ground the reality that, we have DESE to contend with, the Department of Early Childhood and Secondary Education. And so, we could say all of these things, and we're going to have to then take the fight to the State House in terms of really fighting for these changes. But I do know, and based on the work that I've been doing with, that Dr. Crump-Swaby and I have started, and she's been leading everywhere and doing everything in every school that you could possibly imagine, is that we believe we're onto something by really at least starting with the peer education and the peer-to-peer model as an introduction to this, because it does serve to Dr. Jackman's point in terms of the workforce development in the pipeline and exposure to this field, but it also helps young people identify their own triggers and then help support their peers in identifying how to connect their peers to the support services that they need. So, and the fact that the Burke opened up their doors for a very intense program is really about making the accommodation. So I am going to challenge BPS because it's not about a matter of, it really is a matter of the will, right? And being able to say, I'm going to make a commitment, and I need these partners to be able to execute against this vision. And then all we need to do as electeds and as the city and as the district and our community partners like Children's Hospital is figure out what's it going to take. And let's start from there. Even if it's a after-school program, which is how we're running the program at the Burke right now. It's an after-school program, but at the very least, it's consistent. And these young people are also getting paid to learn, and they see the value of this as a viable workforce development option. So I just want to, again, uplift and thank both Dr. Jackman and Dr. Crump-Swaby for always answering the call and showing up and helping us think through what this moment is all about and how we can be possible. So I'm going to ask John, who's also another great thought partner in all of this work when it comes to mental health and wellness, I'm going to give you 5 minutes as well, John, and then we're going to go straight into the youth panel, and then we're going to go into questions because I want the young people to also be heard. So I just want to give the heads up to the youth who are on standby there. After John, we're going straight to you before we go to questions. John, you now have 5 minutes and the floor. Go.
Thank you, Councilor, and let me add my voice to those who have thanked you for pulling this important hearing together. This couldn't be more timely. And for those of you I don't know, my name is John Reardon. I'm the Director of Community Relations and Partnerships at Boston Children's Hospital. But I'm here today channeling Shella Dennery, who Dr. Jackman mentioned, who is the Director of Boston Children's Hospital Neighborhood Partnerships Program, which last year celebrated our 20th year partnership with the Boston Public Schools. The Neighborhood Partnership Program is a school-based behavioral health program committed to working with school communities most impacted by systemic inequalities. It takes several forms. We participate in full-service schools where we send clinicians, hospital clinicians, into the schools full-time, not as fee-for-service, but as supported by the hospital to be able to work with the leadership in that school and the students in that school on the specific needs of that school. But we also have a couple of capacity building undertakings. One is the Training and Access Project, which is available throughout the district to train folks in how to both identify and address social, emotional, and mental health issues. There's also an online portion for folks to do their own sort of self-education. Other ways that the Neighborhood Partnerships Program has supported the schools is through making Break Free from Depression available to the schools, and doing some peer mentoring programming as well. We're also directly supporters of both the Health and Wellness Department and the Behavioral Health Department, and have had a wonderfully long experience working with both of them to develop those departments into I think the very the leading departments in the country in both areas. With the Behavioral Health Department, we've worked for the last 10 years to implement a comprehensive behavioral health model, which is a capacity building approach to developing schools' ability to, again, identify and address mental and behavioral health issues. So with that longstanding partnership, we are thrilled to hear that there's an increased focus in this area. Our recommendations would be that BPS adopt an evidence-based and culturally informed curriculum that is focused on mental and behavioral health. We would also support Dr. Jackman's recommendation that it be administered and overseen by school-based behavioral health professionals, of which BPS has in recent years expanded the base, including both school psychologists and social workers, who it would be great to have them involved in this. I think in part because at this particular point in time, as folks have said, we're going to see a spectrum of responses to the pandemic. And I think it is beneficial to have folks trained in mental health who are doing this training, who can identify issues on the spot as they arise. And it would be our recommendation that the curriculum be embedded in a broader multi-tiered system of support that infuses mental and behavioral health principles and practices in the everyday experience of kids in schools. And with that, I'll turn it back, and thank you for the time, and I hope it did Shella justice.
Thank you, John. I am so grateful to have you here, and Children's Hospital is such a great partner on all things that deal with the mental health and wellness of our students. So thank you for your leadership and your partnership. I am going to transition over to the youth panel, but I wanted to just check in with Councilor Anderson and see if you had any hard stops, or if you wanted to ask any of our community panelists any questions. I just wanted to be mindful of you and your time. Okay. All right. So I'm going to transition over now to the community panel made up of young people. And so we have Wesleyan and Maya. All right. And I believe there's another student that is going to be joining us, Maya, right? Do you know what do we need to, are they here yet?
I can check in right now.
That way we can get everybody going. Cheryl. And there is someone in the Zoom, Anastasia. Is that you? Could someone from Central Staff please let Anastasia in? I believe their hand is up and potentially might be using the phone. And Cheryl, are you using Anastasia's phone?
Hi, I'm Carla. Sorry, I was on the list from before as a community.
Okay. All right. Great. All right. I love to see young people, y'all. You see how they roll? They roll deep. All right. So while we wait, I am going to just create the youth panel here is just to provide some insight of kind of what it's like for them as young people navigating the mental health and wellness space. And I have very specific questions and thoughts that I'd love for them to bring into the space. Maya, in full disclosure, is also our youth liaison. So just so you know, she works for the office. So I want you all to know that. So she's not a mole. She is here in her official capacity as a young person, though. And she also is one of the first pioneers that mental health ambassadors that graduated from the program that Dr. Crump-Swaby led last year, and graduated from that program and has continued to work in different spaces. And what the reason and the very specific voice that I asked Maya, Maya is a Boston resident, but is a MECO student. And while we may not have any jurisdiction over MECO, we do have an opportunity to hear kind of like the experiences of what it's like to go to school in a wealthier district that potentially may be a little bit more resourced when it comes to mental health and wellness, and just kind of to be able to give us some insight to what that looks like. And then we have Wesleyan, who is one of our current Burke mental health ambassadors, who is going to be talking about his experiences and the things that he has been learning as part of his journey, and just provide some insight and some perspective. And then I'll start with you both, and then we'll wait, hopefully. And then Carla, what school you go to? Tell me.
I work at the Boston Project Ministries. I run the Mental Health Ambassadors program here.
Yes, Carla, you are one of our community panelists too. And I'm here thinking you were a teenager. Oh my Lord, so sorry. I'm sure you get that all the time. I was like,
no, thank you. I appreciate it.
All right, so if you don't mind, Carla, do you mind if I start with the youth and then go to you? Yeah, is that okay?
Please do. Thank you.
So I am going to ask I'm going to ask Maya if you want to go first.
Hi, everyone. My name is Maya. Like Councilor stated, I am her youth liaison. I attend Wellesley High School. I'm a senior this year. Prior going to MECO, I was a BPS student. I attended Neighborhood House Charter School, which is right across from the Epiphany in Dorchester. I want to say my experience with that school, first off, we had 5 female, African-American female counselors downstairs that were available all throughout the day. If there was ever anything wrong and there was too many kids, we turned one individual session into group therapy as long as everyone had their consent that was okay, which I found really helpful for me because like Gail said, 15 minutes is not enough time to talk to somebody about what's really going on with you. So if I was interrupted and I felt like someone can come, and we can talk about how we both feel, that's very effective for students because they're not put on a time limit of how long they can talk to someone. I found that very effective for me and also my peers. Transferring to Wellesley, it's super different. I want to say my mental health resources there are pretty low. I mean, I'm going to a predominantly white school. I'm an African-American student going out there. But mental health curriculum is taught in our health education class. But the only problem with that is mental health seems to be the shortest curriculum. Sexual education is longer than mental health, which I'm advocating already out there on my side. But as far as opinions, I do think even group therapy is very effective in that way. Also, I was also thinking because Neighborhood House Charter School isn't linked with any organizations. I'm not sure if I was hearing, I forgot his name, wrong, but they're not linked with any organizations. And I think that it would be helpful if, I'm not sure how many mental health organizations is in Boston. I'm pretty sure not a lot. And that starts with the community, you know what I'm saying? Like I was saying earlier, even getting students to come to this hearing was a really hard thing to do because asking kids to talk about their mental health isn't an easy ask. That's very vulnerable. So getting youth to come to this hearing was especially hard. So I think that shows the lack of how much schools care. I did do like this little thing on Instagram where I asked students to kind of share with me how they felt their school was taking on mental health. And a lot of the comments that I got is they don't feel seen. Personally, I feel that, at a predominantly white school, and I can only imagine that kids are going through so much, and I don't think that we take the time out of our day to think about what they may be going through outside of school. You know, we're so stuck in education and the curriculum in school, but I don't think we take enough time to think about how people are really dealing with the outside world. So I get a lot of, I don't feel seen. I don't feel like I can go to teachers and talk to them because they're not asking. Nobody's really asking kids throughout the day, how are you doing today? Or how was yesterday? You look down. So if we're not being asked, then it's really hard to just go to somebody and say, I'm not doing okay today. And I think that just shows the lack of how much administration, teachers, etc., really care about their students in schools. And I think as a community, that's the first thing that we should be wanting to do is care for our youth. And as Dr. Charmaine, I think, said earlier, it's important that, it's a revolutionary thing. This has been happening before COVID, and once COVID hit, it actually started to hit high rocket, and then now that COVID's over, kids are acknowledging how they feel, but they don't know what to do with that. And I think it's especially important that we make sure if we're going to get more counselors, more therapy and curriculum, that it is Black and Brown administration teaching our kids these things. Also, at my old school, which I think it's very important, which we should be making sure we're having in our schools, is racial trauma. I was never taught that until I went to a predominantly white school and there was a class designated to race, gender, and all of that stuff. And I never took the time to realize after that class that my everyday interactions because of the color of my skin is affecting my mental health. I didn't learn that until my senior year. And this is stuff that we should know prior. You know what I'm saying? Kids should be knowing this. My brother is 4 years old. He goes to MECO as well. And he's experiencing mental health in 4th grade. So it starts young. I don't think that, we should be taught later in life. We need to learn earlier. And I am working with Dr. Gail as well. She's doing all the great work. And as Counselor did mention, I had the honor of being one of her ambassadors in the program. And that was super effective, peer on peer, getting to learn the curriculum and teach other people about that. These resources are good. And when the youth know them, they share that to their other friends because we need it. And I'm just very grateful for that. Gail, thank you so much. And I think we need more of that, especially even if it's not in schools, which we should, outside organizations. How are organizations setting up mental health for our youth? This is a community thing. And yeah, that's all I have to say. Thank you, Counselor.
Thank you, Maya. Thank you, thank you, thank you. And again, I wanted for BPS, we know that you don't have any jurisdictions over any other schools outside of the district, but I wanted to just bring in different types of environments that our students are in, because regardless of whether or not it's within the district, there are still peers of students who are in different spaces, and there needs to be some sort of standard across, like the whole spectrum of education. That's something for DESE, but I just want to name that people are getting different things in different spaces, but then when they all come together in their community outside of school, that there's an opportunity there also to really help support the well-being of our Boston residents in general. So just wanted to name that. And I know, and being the chair of Boston Public Schools, I understand that most of our, where we have any powers of lever is within the district. So I want to just name that, and just so you know that I see that. So I am going to ask Wesleyan, who is a Burke student, and I also want to just give him a shout out, because Wesleyan answered the call, was like, yes, I will do it. And so I just want to say thank you for standing up in a short period of time and raising your hand to have your voice heard here tonight. So you now have 5 minutes and the floor, and thank you, Maya. As always, a great job. Hey, Wesleyan.
So hi, my name is Wesleyan. I'm a student at the Burke. This is my first year at the Burke. I'm a senior, and when I first came to the school, like when the school year first started, I wasn't really showing up to school because, issues I had dealing in my house and things like that. And it took me a while before I came to school. I came on the first day, and then I missed about 2 weeks before I came back. And on my first day that I came back, they had me talk to the school counselor. And I don't know, it was just, if it gave me somebody to talk to other than, your parents or a teacher that, you have to go to class and see every day. It gave me like a chance to be a little honest and to just get certain things out of my head, and because it was mainly just me, like being stuck in my own head, overthinking, dealing with my anxiety. So it was nice for me to talk to somebody like that, and I still see her weekly. And I also know that I only have one counselor in my school for the juniors and seniors, and not a lot of kids get to see her. And I speak to her about that, about there being other kids that, also need this help more than just me and a couple other students, in my grade. And so I talked to multiple people about it, but a lot of people don't feel like safe. Like, I don't need therapy. I don't need to talk to anybody, so it's hard, especially me trying to convince my friends to talk to counselors, because a lot of the things that I have issues with, a lot of my friends, a lot of my peers have issues with too. And there's not really a space to talk about it at all unless you don't open your voice and try to reach out. That's pretty much it.
All right, I was on mute, so sorry, Lesbian. So thank you. And before we move on to Carla, I just really want to thank both of you. As young people, it is really hard to just show up in general, but to do so and bring your full self into the space to help us understand what young people are carrying and how they're navigating in these spaces is really important, because the more that we hear from y'all who are living these realities, the better we can as adults help create the type of environments that are going to help you all be seen, right, and feel heard and supported. And so I just want to say thank you both for bringing that perspective into the space. I see you and I hear you. And I'm going to ask Carla, I know that you are here representing Boston, the Boston Project Ministries, right? And you are here, ready to go.
Thank you so much. I appreciate your invite. Thank you, Dr. Gale, for inviting me as well. As mentioned, I work for the Boston Project Ministries. We have a mental health ambassadors teen employment program that where the teens are able to make $15 an hour and learn about mental health through Dr. Gale's through Dr. Gale's training, mental health ambassadors training. Maya was actually one of the trainers in the summer, and it was really great and very effective. But as you know, I'm sure none of you have heard of Boston Project Ministries, and it's obvious it's a little bit harder for them to be able to get something like this, get a job like this, or go out of their way to learn about mental health. But once they did, I wanted to share a lot of the effects of it, the positive effects that comes out of teens learning about mental health. For instance, all of my teens, well, let me preface by saying all of my teens that I've had for the past year and some change have gone to BPS schools, mostly Tech Boston, and the Henderson, New Mission, but most of the teens that come through Boston Project that go to Tech Boston. So I want to start there. And Savannah Broxton, who is a sophomore now at Tech Boston, she says that learning about mental health will end the stigma, and it actually encouraged her to ask for help when she was struggling. So something else she said, it helps her build on a positive mindset, and it gives her a space to understand herself and those around her, which is obviously the social and emotional piece that comes from learning about mental health. And it also helps her and her peers here at the Boston Project make better decisions. I also want to speak to the fact that they have learned about themselves, let's speak on that again, and that it increases their, I'm sorry, I lost my train of thought, but youth-led discussions are important as well. And it's given them the space to speak on their own experiences, because something I tell my teens often is that they are experts on their own experiences, and having a mental health curriculum, especially that is discussion-based, could definitely help them in that space and in that arena. And I've seen it in my own work, that allowing them to speak on their own either experiences with mental health or what they've seen on it demystifies a lot of the conversation around mental health and mental illnesses, which will in turn allow them to open up to other adult figures that are trustworthy, and hopefully reduce a lot of the suicidality and really sense of hopelessness amongst our teens. So I think that I've seen that in the past. In my teens now, they have been more open to speaking with me, because I tell them that they know best about what's going on in their head, and especially with the education overall on mental health, that's really helped them. So thank you all for listening. I appreciate the time.
Thank you. I was just looking, you did not use all your time. Okay, thank you. That was good. And I appreciate you naming the students and the schools that they go to, because I think it's important for the BPS administration to know kind of where the traction is, right? Where's the energy, and who are the schools that are taking advantage of some of the community resources that exist to help support the mental health and wellness of our students. So thank you for sharing that. I'm going to see if Councilor Anderson, I know I see you here. If you wanted to start with your questions, I have a few, but I wanted to defer to you first. Councilor Anderson, you have the floor if you are interested.
Thank you so much, Madam Chair. Can you hear me?
Absolutely, yes.
Thank you. I know we're having a little bit of difficulty. Thank you so much for the panelists. Professor Crumswaby, nice to see you on here. As the Madam Chairwoman mentioned, we learn from the best, and so pleased to see you here. And thank you for Maya, Carla, and Wesleyan, and Aurelio, and everybody else who testified today. Your input, your experiences, of course, are extremely important, and look forward to hopefully a working session, Madam Chair. I think that I'm still trying to figure out how we can dissect whatever is in place, looking at services. I heard a lot about not having enough mental health providers. I heard a lot about specifically timing. I'll say this, one of the issues with our mental health services is that a lot of the providers are bombarded or inundated with a high caseload. So what ends up happening is sessions feel rushed, and specifically for the students, for the adolescent, either at home or school-based or community-based, you are seeing participants for a very short period of time. And the other thing is that I find that a lot of the Mass Health or the insurances that actually cover supports services, that we're not actually addressing the diagnosis sometimes properly, right? And I know the doctors can agree with me, that we are diagnosing too fast or over-diagnosing or misdiagnosing. And we know that some situations are circumstantial or temporary. The risk with that is if you're on a panel with Mass Health or insurance, they don't cover anything that is not a medical necessity, right? So in order for you to actually cover services, you have to have a diagnosis. So diagnosis comes first, and then obviously you're doing your CANs, your assessment, but once you have the diagnosis, it's a very short time for you to have a diagnosis and then for you to actually render services. The problem with that is you ended up not really getting to know this person, and you have diagnosed me because of my situational, circumstantial depression, and now I'm stuck with this very, sometimes very harsh diagnosis that may not actually pertain to my situation in 3 months or in 4 months or 5 months. So I think it's risky because we continue to perpetuate services, again, reactionary services or after the fact, and we're not actually addressing, to Councilor Mejia's point today with this filing, we're not addressing the issue beforehand. So even if we are to increase social workers or providers in schools, and we're to increase them in an experiential learning type of curriculum, or we're to increase them in activities, it could be more group therapeutic settings, it could be circle of healing or restorative healing types of curriculums or groups, activities, field trips even that are therapeutic, different exercises, artistic exercises. So it's not just teaching a thing, it's actually creating what Councilor Mejia alludes to a lot, that experiential learning that connects to artistic endeavors or and so forth. It could be science, it could be exercise. I mentioned before sports. And so my concern is that we will continue to create this ripple effect of diagnosing a whole bunch of Black and brown children in our schools without proper services, without preventative measures, without proper facilities, without proper curriculum, without proper experiences, without proper resources. And so services are great, but now we're talking about services that are too short or not enough. And on top of that, to add to injury, we don't even invest fiscally, we don't even invest properly fiscally in our schools with the facilities and everything that adds substance to your mental health treatment or journey. And so I agree that this is a multidimensional, it's a huge spectrum of circumstantial situations as well as disorders and permanent, situations. However, we're creating a pipeline to labeling and also not properly responding to the harm. And so I would say I agree with all of the young people here who testified. I mean, I'm young too. Professor Crump would disagree, but I agree with all the young people here who testified. You guys know best as to your experiences. I really appreciated Professor Crump's-Waby's and Dr. Jackman's real tangible examples of what that is, especially the one about your daughter, Professor. And now we have a responsibility to sit down in a working session, hopefully through Madam's Chair's permission, to be able to dissect this service. What exactly is in place and how do we tackle this? And I think that an action plan itself in a working session to map out all of the resources and what does it mean to address mental health in a holistic way. That means we will look at all of the different types of services in place. This is not to take away from health and wellness what they're already providing, but this is to add, because we know they're doing their job, but how do we add to those resources to ensure that this is being done properly? And then I would say that a curriculum would be perfect or hopefully enough to create benchmarks to measure how are we doing in making progress equitably, but also to develop our students and supporting our students' academic success in the schools. Madam Chair, thank you so very much. I look forward to the working sessions because I think that's where we will bring, hopefully, these testimonies and more of the services and really look at this work in a very critical but comprehensive way to make sense out of it. And hopefully, we're imploring BPS to listen and to welcome these ideas and to take our recommendations at the end of this. Thank you so much.
Thank you. Thank you, Councilor Anderson. And before I move on to my questions, just wanted to see if anyone wanted to reflect, react, contribute, or because I know that my colleague is just like me. We are beyond the conversation at this point, right? We really want to make sure that these spaces, when we're inviting everyone in, is that, more so the administration is really understanding what this moment is all about. And you've heard it from everyone who has spoken thus far, is that we can't keep having the same conversation and expecting different results. We need to be able to invest. And that investment is both financial, and that's also time commitment, and that's also a political will to say, you know what, we're going to change the culture in our district and lead with wellness. And that's going to take us doing X, Y, and Z. And here's how we're going to define success. And I think that level of thoughtfulness and that level of thinking is what I'm going to be looking at when we start our public hearings, because the budget season is upon us, and you trust, and you better know that, and I'm letting everybody know who's listening, that this is definitely something that I would like to see the district invest in, like in some real meaningful way. And that means setting up our schools, all 123 of them, every single grade, every single classroom, and that it doesn't become any more a commercial about how and what we're trying to do, but here is what we're going to do, and here's what the outcome is going to look like. That's the type of urgency and reaction that I'm really looking for from the districts when we continue to have these conversations. So I just want to sound the alarm that this is going to be one of the things that I'm going to fight for unapologetically. So I am going to ask a few questions to our community panelists and some of our young people to help us kind of ground and level set. When you think about what a mental health and wellness school environment looks like, can you just let's just dream here. What are some, just 3 things that are basic that you think every school should have? 3. Y'all, I'm not asking y'all for, don't give me a whole paragraph because I only have 5 minutes, but if y'all can just give me 3 things that this is wishful thinking right now. This is an opportunity for us to really help support the district in meeting this moment. So I'm going to give you all a little bit of time. Wesleyan, I know you're off camera, but if you want to participate, would love to hear your thoughts. I know you mentioned not having enough guidance counselors and social workers who can meet the needs of all of your peers. So I know that I heard that from you. Maya, I see your hand up, so I'll start with you.
I think morning meditation, setting the morning off with some type of relaxation for your mind. I definitely think more outside time, like hands-on. I mean, sitting down in a chair for like 6 hours is super draining. So getting up, getting active, and daily check-ins in all the classrooms. Who wants to step into a classroom and get right into the work without being asked, how are you doing today? Those are the 3 basic general things.
Yeah. And you know what I love about that, Jill, is that none of that costs a cent. Right? I mean, like, then, because y'all be like, oh, we don't got no money. Yeah, well, look, y'all just have to shift your culture here. Like, that's it. It's as simple as that. And as school leaders, you reserve the right to do that. And you could find the way to make those things happen. So, morning motivation, that's amazing. And I think it's a low-hanging fruit. So, and daily check-ins and outside activities. I know y'all got 20 minutes of recess, and I don't even know if you get recess after you're in high school. Oh my God, no, right? So,
Yeah, it's K to 8 is 20 minutes of recess, but then we have had a big initiative still continuing is integrating movement breaks into the classrooms. And so that's like a huge thing going on, which connects to her, the second point about, just moving, whether that's outdoor or inside, being able to have some of those breaks in the middle of whatever hard work you're doing. So totally agree with that. And the check-in part is what we call our welcoming activities. And so we ask all of our teachers and even in our adult meetings to have a welcoming activity. That's part of our CEL signature practices, if you will. We were talking about CEL versus mental health before, but this is one of those practices. And lots of schools are doing that. And then I love the morning meditation piece. That's so awesome. And we do have some schools that are implementing some different curricula that are all about that kind of making it easy for teachers to just have a meditation. So I love that.
Thank you. Okay. Just wondering if any of the doctors would like to also chime in.
Yep. I can, here we go. I can add in. I think specifically, can you guys hear me okay? Yes. Great. Again, specifically thinking about some of the primary mental health concerns that we see. I think the unique thing about adolescents and why, I think this is definitely important across all grades, but a focus on adolescents because this is when we tend to see early signs of mental health conditions really get worse or, kind of manifest. So having specific content that's focused on depression, anxiety. I think we see a lot of trauma and trauma response in our young people in the city. So having something that focuses on PTSD and then early signs of thought disorders and psychosis. Again, because the goal is to increase knowledge and awareness and destigmatize. A focus would be on also how to ask for help and how to access help in the community and in the school. I think that's one thing, but that's many things.
Well, that's great.
I think one thing that I didn't mention was particularly when families require more intensive services. We definitely partnered with the BEST team. One of the challenges that I've heard from other schools, I think we had a pretty good way of managing that. But when police responded with ambulance for a child who may need to be hospitalized, that sometimes those officers, or even within the school police, didn't have the best response when responding to a young person with a mental health condition. So ensuring that our training not only includes teachers and formal educators, but school police and any police. I was even having a protocol for when police respond to a school for a mental health condition. What is the protocol? Checking in with the school council, just having a central and like I think you guys call those circulars that really speaks to how people should act in those situations. I will leave it there.
Thank you. Thank you. Okay. Any other thoughts, things, reflections that we should really, lean into here? I mean,
I think Dr. Jackman and Maya kind of mentioned, pretty much what I had been thinking about. In addition to the check-in, I would just want to also have us include a checkout, because sometimes young people have already checked out in the middle of the class, so it's important to help them transition to the next thing. So even if it's again a meditation out of, right? So that's another thing to think about. Not only you're checking in, but you're checking out as well in terms of whatever you were doing within the context of that 90 minutes, 45 minutes class that you've had. Then the other thing I would, like to make a suggestion about, so many high schoolers have to do community service. If they are taught in terms of their own a mental health curriculum, you can have them do community service with the elementary school children, because a lot of younger kids look up to the teenagers. And if you have a facilitator, a mental health counselor, or a practitioner who's working alongside that young person who's doing community service, again, it's what they are required to, many of them in high school are required to have community service. That might be one way for them to gain some community service as well.
Thank you. I think, Jill, what you're hearing is a lot of low cost, partner rich opportunities, right? And ways for us to kind of meet this moment. And I know the title of this hearing order was a curriculum. I think that we, to Councilor Luigien's earlier point in terms of just piloting and building something like, Dr. Crump-Swaby and the program that she has created. And we've been, we first started it off with just in community outside of the schools, but with students who were in different types of schools. And then our second year, we went into a school and we're working directly in a school. So each environment teaches us something about what it looks like. But I think that, we're just gonna have to dive into and start figuring things out and rolling things in, right? Like, I don't think that we should wait until all 123 schools are ready to onboard. I think that what we need to do is identify that, maybe look at the city as a whole and look at some of the regions where they have the highest rate of trauma, and identify some of those schools and build something for K through 12 in different spaces, and then learn from that and then roll it out. So something bigger, and so that you can replicate, because I really do think the way BPS and then just systems work, it just slows down the process. And I think that that's why I do most of my work in community with nonprofit organizations and groups outside of the district or outside of City Hall, just because I don't have time to wait for stuff. I'm just trying to do as many things as I can and let y'all catch up to the times. And I feel like you all are well resourced. You have millions of dollars that we approve every single budget season. And the fact is that tons of money goes into social and emotional and trauma, but we just don't, in terms of like a return on that investment, it's really hard for us to see that outcome, right? And I think that that's probably why we're thinking of partnering up with other folks maybe creating a curriculum that we can start off with some baseline data, and then we could figure out whether or not that return on investment is making those outcomes, right? I just think that something has to give, and I'm just not sure what it is. John, I see you.
Just one other thought that I'd throw out there. It gets to, I think, something that Councilor Anderson had said is sort of how do you demonstrate progress, or how do you monitor what's taking place? And there are screening tools that we have used at BPS that identify kids that need some additional attention, but they also allow the teachers to progress monitor the kids to see how they're doing once they leave the classroom, and whether they're, adjusting how they're doing academically. So I think there are tools that might be put in place to make sure that some of the work that's going on in this area is having the desired impact.
Thank you for that. Okay. Let me find out Cheryl wants to join in on the community panel. Go ahead. Bring it on.
Oh, thank you so much for this rich conversation, and I appreciate all of what is being done in the community, and I especially want to lift up the action step that was mentioned about all of us coming to the table and and sharing our resources. Really, that's all. I'm excited and energized and very passionate about this work.
Thank you, Cheryl. Thank you. Really do appreciate you. And Jenna, like, you've been here the whole entire time. I thought, well, somebody had a hard stop. I don't know if it was you or not, but
I have a hard stop at 6. Dr. Simon had a hard stop at 5.
Okay. The conversation is so good. You like, yes, I love it.
Yes, I did actually want to stay for the young people. That is why I stayed on. That's most important to me, is to really hear from them. And I also wanted to uplift what Maya said, having, and Westland, both talking about having enough social workers, guidance counselors. This year coming up, we will have a social worker in every school that we can say we really do. And then we just posted, so that I'm not using acronyms, students with limited or interrupted formal education, SLIFE social workers, one for each program, and a district social worker that will support them. So we have heard that we need to be supporting students, and I wanted at least the people on this panel to know that as I came into this role, that is something we wrote the job description and impact bargained with the union fairly quickly to make sure that we could get that for the fall. And really, we are always open to listening and working with the community. And, definitely what Councilor Mejia says, resource rich. And how does it go, Councilor Mejia? Resource rich, collaboration poor?
Well, that too, but it's resource rich and coordination poor. I mean, like, we have so many resources. We just got to step up our coordination game, because we're rich here. Look at all this genius that exists in this hearing, right? From every different type of walk of life and entity. I just think that, if we will all get together, to Councilor Anderson's recommendation, as I continue to move through this conversation, it's really about, like, how do we get to where we need to be? And it's all of us right here having the same conversation. So resource rich, coordination poor. And I see Jill.
I just wanted to say, as you're ending, I really appreciated, I think it was Councilor Anderson talking about a holistic approach to youth around this issue. We, not just in BPS, but I think at least in the United States, we break mental health and physical health into different places. And we don't think about, Maya talked about getting outside and moving and, meditating. And so sometimes because we have specialists that specialize in different places, we tend to then break things up. And so I just think about when we want kids to be healthy, when we want adults to be healthy, there are certain things about, like, how do we communicate? What skills do we have for saying to ask for help? How do we set goals? Those things cut across all the areas of our health and well-being. So I look forward to that comprehensive approach and that planned and integrated approach that she was referencing, because I really think that's really what we need. So thank you for all that you're doing. Really grateful to everybody on this panel. Love hearing the student voices. So
thank you for that. And I'll just uplift really quick that Dr. Crump-Swaby and I were founding members of a nonprofit organization called C-Plan that I used to lead, and we always talked about the whole child, and that in our advocacy space, they wanted to compartmentalize our kids into different little buckets. And we as parents were always trying to push the conversation so that we can see our children as we see them whole. And so this whole idea around mental health and wellness having its own separate thing, it should be a part of just the culture that we're trying to create. And the only way we're going to be set up for that success is if we make those investments. And I'm going to keep talking about investments because it's time commitment. That's an investment. It's financial commitment. And it's also emotional commitment, that we're willing to do that work as adults so that our children could also see and model that behavior, that it's okay not to be okay. I'll just ask one more question before we open up to public testimony. And it's really not so much a question, it's just more of a comment that I wanted to offer here as we continue to move through this, is that, I always talk about my own journey here, and I think that the personal is professional and the professional is oftentimes political, as my colleague, Councilor Lada, always uplifts. And, I have shared openly my own struggle with mental health. When I was a kid, I talk about the fact that I attempted suicide and my mom was too afraid to take me to the hospital. And I think a lot of it had to do because she was undocumented and was afraid that they would take me away from her. But that fear prevented me from getting the support services that I needed, right? And so I share this because it's not just about the sake of having this conversation for the sake of having this conversation, is to understand that there are a lot of young people who are struggling right now and are living in homes where they can be fully expressed. And if the only space that they're going to get whatever care that they need is in our schools, then we are going to have to do whatever it takes to make sure that we are ready to provide that child with whatever support services they need. And it was a teacher through my writing that realized that I needed some additional support. And it was through a creative writing class that identified that I needed support. And so I share that with you all because I think that sometimes the politics and the need to get things right get in the way of the right thing to do. And I want to share that with you because I think if we are serious about meeting this moment, then we're going to roll up our sleeves and do whatever it takes to make sure that our kids are seen and expressed and embraced, and that we do whatever it takes. I don't want to have this conversation next year. I don't. I really want us to come back with an evaluation tool of how well we did in the next school year. I really do. I want BPS and my IGR person, whoever's listening here to this hearing, because they do listen, is that I really want a commitment from BPS that we're going to do something different as it relates to mental health and wellness for students. Jill, I'm not asking you to make that commitment because you can't, but I really do think that we have to be urgent, and we have to, because we're losing our kids. They're checking out. And so we need to do better. And I know that we're going to do better because you guys are committed to doing that work. So I'm encouraged by that. And the last plug that I'll say is that I am excited about our partnership with the Burke. We're going to be hosting a mental health and wellness day. Dr. Crumpswaby, is that okay to say? Did we get clearance for that? I don't know, did we? Oh my God.
Yes, yes.
Okay.
The young people are in the planning stages as we speak, yes.
We got approval from the higher ups that we're going to shut down the school for a day of wellness. And we're going to invite you, John, and Children's Hospital to be a part of that because we're going to need a lot of resources. But it's going to be a day of wellness for the school, and that's the staff and the students. And then in the evening, we're going to open it up to the parents because we can't send our kids back into spaces and places where they're not going to be received with the type of emotional intelligence and, you know, the social, you know, just the wellness that they need to be okay, right? So we'll invite the district to participate in that because what we want, Jill, if we can't get a curriculum this year, well, I will want my second backup question and ask is for the district to adopt a day of wellness where we, every single school, all 123 or who knows how many schools we'll have left by the time y'all get done with this Green New Deal, but however many schools are still left, I think that every school in the district should shut down and we should do a day of wellness. And we need to create culture of that. We need to shift that. So even if we start off with a day of wellness and it's a day of activity across the entire district and that's our curriculum, I'll take that. But we need something. So I just want to name that. I need to feel like this conversation of 3 hours landed in some sort of deliverable and that's tangible. So we're going to do it at the Burke as a pilot. Y'all can come learn and then maybe do it next year for the whole district. But something has to give. So I hope that you all are leaving inspired and ready, right? We're feeling good because I don't want y'all to need some therapy after my sessions, right? Because I'm glad that I see Jill laughing there. So that means, and Cheryl, okay, and John, I know you were here for all of this too. So Dr. Jackman, Dr. Crumpswaby, Westland, Maya, you know, Dr. Anderson, that you stayed here all this time. Thank you, Jenna. Thank you, Central Staff. Thank you to my Chief of Staff, Luz, who helped coordinate and get everybody here into the space. So just wanted to just end with some gratitude and just thank you all for your partnership. And I look forward to building with each and every one of you. And we're gonna now open it up for public testimony. And Central Staff, I'll let me know if there's anyone here for public testimony.
Ethan, do we still have anybody? It seems like we don't.
T. Robinson.
Okay.
Yes.
T. Robinson, you now have 2 minutes and the floor.
I'm not sure I'm gonna need 2 minutes, and I appreciate you guys for having this. I'm actually here on behalf of Maya and 617 Peak. We're a nonprofit organization out of Boston that encourages youth to use their voice through written and spoken word, and Maya is one of our cohorts. And so he presented this to us, and I'd be remiss if I didn't get on. I went to John D. O'Brien, and I just really want to say I think this is something you need to look at. You do, you really do, and I appreciate you making a space for this as somebody that exited Boston public schools because of lapse of things like this. I think it's important. I think it's very important, and I want to be very transparent with you guys that a lot of the work that we do is rooted in this. So, just wholeheartedly, we appreciate this platform, and thank you for giving our kids some attention. That's all. Thank you, guys.
Thank you.
Thank you.
Thank you. Thank you. Thank you. And that is why we exist in this world. And why we take this work serious. And I'm so grateful that vulnerability is the most it's the superpower that we have. And I think as adults and as children, we have been encouraged to just be strong and to just keep going on. But there is some strength in your vulnerability. So for those who are tuning in, man, I am telling you, being vulnerable is your power. And Mr. Robinson, I really do appreciate you bringing your full self into this space. So thank you for that.
And sorry, guys, but I appreciate that. And it's something that I think, I know I was strong and I found my way through it, but not everybody is. I lost my best friend to that, and it's something I carry with me every day, and I think to just understand when you walk in those halls. I mean, we went back trying to do things in the school, and it's not really welcomed. It's an energy thing, and Maya hit it, nail on the head. I went to Brimmer in May, and the whole school gathers every day. Every day we meet in that hall. It was K through 12. Those kindergartners come to our games. Those first graders come, and you create a bond with those kids. And if not for yourself, for them, it puts you in better places because there's somebody looking up to you, and it gives you a light. And just even going back to O'Brien and realizing, man, it's gotten worse. I get it. Everybody has a job, and we're showing up to do our jobs, but we'd be remiss if we left this piece untouched. It's just not right. And you can't come in and learn math and science and do these things if your whole self isn't there. It's just not possible. It's just not possible. And you can't walk through a door and flip a switch and just attention forward. It's not real. And we'd be fooling ourselves any further at this point. And, again, I won't bore you guys with this, but I appreciate this more than you guys will understand. I mean, we're working our angle, very small nonprofit. We're in our 5th, 6th year, but it's honestly admirable to see this type of conversation happen.
Thank you. Thank you. Okay, guys. Thank you, Mr. Robinson, and I look forward to partnering and figuring out how we can build outside of this little space that we're here in Zoom, and thank you again. And I'm going to ask central staff if there's anyone else signed up. I know we are over scheduled, so I wanted to just be mindful, and I want to end with gratitude. I just want to thank everyone again for spending so much time and energy here today with us. It was a long hearing, but I hope that you walk away feeling better now than what you did when you first came in. I hope you are leaving here feeling full. And so thank you. I am going to call
Before you close, Councilor Mejia, just a real quick, just as you just mentioned, I wanted to make sure we ended with just a mindful moment for people to take a breath or to think about what you're going to do next. What are you going to do after this to take care of yourself? Whether it's get a walk, it's still shining, or just so. Sorry for interrupting, but I think it's just important to just make sure we put that back here as we check out, as Dr. Gail and Maya mentioned.
I know, and I'm having anxiety because I have another Zoom that I was supposed to be at 6. So I'm checking out and going straight to another Zoom, but that's just me. But you're absolutely right. I think I'm going to go check in on my daughter who came in quietly while I was doing this. So get a little bit of love from her so I can keep doing this work. So that's going to be my mindfulness moment. So thank you for encouraging us to just pause and be. All right. All right. Okay, I'm going to call this hearing to an end. This hearing is adjourned. Thank you. Thank you, guys.
Thank you.
That's great. All right.